Can you guys speak up? Can you guys hear us?
Yeah, we can hear you. Can you hear us?
Hi, good morning, Ron.
Morning, Dishan. We can hear you.
Someone muted? आवाज नहीं आ रही.
हमें आपकी आ रही है आवाज.
Basic class next week. I'm off Monday, Tuesday.
Yeah, because in the break we'll sit down and I will make all your availability for the next 2 months. Yeah.
And after in the office.
Okay.
I'll get out. Monday, Tuesday, Wednesday, and Monday, Tuesday, Wednesday. शाम को शिफ्ट करते हुए पेमेंट करना.
शाम को अलग से एक क्लास शुरू कर देंगे. जो स्टूडेंट लोग होते हैं उनको पूरा रोजाना टाइम चाहिए. तो देख लेते हैं जो वो कर लेते हैं. मैं चाह रहा हूँ शाम पे क्लास शुरू कर वीकेंड कर देते हैं. 3 शुरू कर देते हैं.
जो लोग अभी देर में जो हाउस कीपिंग करते, किचन में करते सुबह को, because they know the opportunity. अभी नए contract is $29 an hour by HCAs. 28.62 Nessus.
Hello, guys. Can you hear us? Yeah.
Yes.
Okay. All right. इसको डेटा कुछ में डालना पड़ेगा.
इसमें डालो. इंस्ट्रक्टर रिसोर्सेज तो नजर आया था यहाँ पे. Right here on my documents, instructor resources. So basically, when you go to documents, right here, see, all the everything is there by the way.
Oh, perfect.
Right, documents, and then Zoom. If you go to the Zoom. So what? This is a Zoom, by the way, right? I think what did I do? Zoom meeting. Shows. There you go. Yeah, can you sit into the Zoom by the way? And he can ask what we covered. Yeah, it has already there. It's all in the folder. Is there in documents?
Okay. अच्छा आपको
With button and the palm.
Good morning, guys. Can you hear me?
Good morning. Yes, we can hear you.
Morning, sir.
My name is Sal. I've been teaching this college for a little while, and so you're gonna sit with me today. Do you guys know what chapter are we doing today?
What did we cover yesterday?
I think we're doing chapter 18.
18.
Yeah,
Chapter
last
18.
time we did 17. It was the hygiene one.
Okay,
Yeah, so after chapter 17, we go to 18.
18. Okay, how many chapters you normally do?
2 chapters.
2 chapters?
2, yeah.
Okay, awesome. Okay, thank you. I'm gonna get set up, and then you guys can log onto your PowerPoint portal, and I'm gonna set up mine.
Okay.
Uh, just where, how do I go on the Hello, good morning. So try to unmute, then we can
Morning.
communicate for a few minutes and then you guys can mute and then my name is SAL. I have quite a bit of experience teaching and working in practical. So we're gonna be doing chapter 18, grooming, which is the most important part of any healthcare. So I'm gonna ask you a few questions. What is the most important thing regarding your patient or your resident when you're doing grooming and personal care?
You need to be clean.
You need to be clean. That's good,
We need to wear some like nice clothes, like clean clothes.
right?
Yeah. Personal hygiene should be taken care of.
Personal hygiene. What is the most important thing? These are all part of that. The most important thing you think is?
We need to keep things confidential, like respect their opinion
Yeah,
and privacy.
exactly. That's the most important thing, is providing dignity and privacy when you're doing a personal care. Only responsible people, like who are in the healthcare, your team partner, somebody should be in the room. Curtain closed, door closed, and you're gonna be providing them with total privacy. It's only 4 of you guys. Do you know we're still missing 2 people, right?
Sorry?
Are we missing any students?
No,
No,
it's always been us 3.
Yeah, a couple of new students joined, but I don't know when they'll be like they joined last week. I'm not sure whether they'll be in the class or not.
Okay, so it's just 3 of you, right?
Yes.
Yeah, most of the time.
Yeah, that's good. Okay, so can you open your, you guys can view your own PowerPoints?
No, we always just let the teacher just share her screen and then she just reads it to us basically.
Yeah, but Michael said that if you log on to your student portal, you will be able to view it there if you want to review. So it's good to keep it with you for your, when you do your assignments and stuff like that.
Okay.
So let's go over with a few key terms that you need to know. Do you guys have your text or? So alopecia, what does that mean?
What does what mean?
Like, look at your key terms in your book. The first word, alopecia, hair loss. Somebody who's losing quite a bit of hair. And then anti-embryolotic stocking, which is also known as TED stockings or compression stockings. It is applied to people with peripheral edema who have swollen legs, so that the fluid gets circulated back to your heart to get, and then to your kidneys to get pumped out. It's very important if you're doing your hygiene, like grooming and dressing, to keep an eye of this peripheral. The way you can test it, take your finger, you press on it, and it will take, depends of how long it takes for it to come back. That's how your stages. Notify your nurse on duty. Guys know about dandruff. Ingrown hair, like ingrown nails, ingrown hair. These are lice, that's pretty common, especially when it comes to spring and summer. You might notice lice and bed bugs. So it's really good to keep an eye for that. And if you're doing your grooming, to make sure, like, if you notice any kind of insect bites or anything, to report it and do a thorough inspection. Okay, so those are just a few basic ones. Okay, so let's start. Can you guys see my screen?
Yes.
That's good. Okay, so grooming. We all groom ourselves every morning and then 5 times a day, and so does your patients. But they won't leave the room until they get nicely groomed and change of clothes. Just gonna go a little bigger.
You see the zoom, you just keep pressing on the plus thingy to make it bigger. No, 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 no. You see how you did go back to how you did at first?
Okay. Grooming, and important to many clients. It's very important for everybody. On this Zoom.
No, 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 no.
I think there are 3 dots, right?
Press on fit.
This one?
The fit, Fit, right there.
Left
Post-
side.
Yeah,
Ah.
press zoom and 100%.
That's too big.
It's too big.
Yeah, okay, there. Much better. Nice. Now I can see. I'm just gonna minimize you guys. Okay. But you can still see me. Okay. So grooming is very important to many clients. All their life, your clients, your patients has like they've been waking up, dressing themselves, making themselves look pretty. And when they want to like get up in the morning, they will make sure that they are looking the same as they did 20 years ago. Also, it helps with prevention infection and promote comfort. So imagine you wake up and you don't take a shower for like 4 or 5 days, how you feel. So that would make you, you're gonna have dead skin. You will have, buildup of oil and stuff on your skin. So you need to wash them. Promote emotional well-being and self-confidence. So imagine somebody walking out, you walk out from your bed and walk out in the public, you will not like it. So that's how your clients and your patients gonna want that. It's very important for you, them, for the confidence to look good. So every client, you have to take it as a client-centered. That means every client is different. They have their own preference of hygiene, own preference of what kind of clothes they want to wear. So they define grooming measures. Some like to wake up in the morning, take a shower, and some want to take a shower in the evening, morning they just want to brush, freshen themselves. So every client is different. So and then as the caregivers, you need to respect their decisions. Always respect clients' dignity and right for privacy. This is one of the very important thing. I've seen that, like, some of the time, if you walk out in the long-term care, the RCAs are doing personal care and the door or curtain is wide open. and the client is totally exposed, and that's not providing them dignity. It's really, really bad. Oh, so you've probably been to on a tour, like you've seen lots of places, lots of care home, assisted living. They have their own hair salon where the hairdresser comes, does the hair right at the facility, at the location. So it's very important how the hair looks and feels affects the person's emotional well-being. So so how it affects the person's well-being. Assist with hair care whenever needed. It's really important. Like some of us, like we don't have to worry about self, but you want to wake up, you want to make your hair look nice and everything. So you assist with hair care whenever needed. So where would you find that information? Like what is the request, the needs, what kind of hair they like? It's in the client care plan. Always indicate on the personal grooming and under the ADLs, you'll find what the client prefers. So when you're doing the hair care, what are you looking for? Can we discuss this?
Like the patient has any kind of allergies or like any medication he's taking for the hair, or just the things we need to tell the groomer.
That's good because yeah, you can hair is a very if the client has some kind of deficiency in the body, you can you will know by when you do the hair care, the hair breaks easily, the scalp is dry, and yeah, it could be lack of iron or something, or the body is lacking like moisture. They're not drinking enough water. Anything else?
Sometimes there's lice in their hair or bugs that go in their hair.
Awesome. That's good. What else for dry dandruff?
Yeah, dry scalp too.
Yeah.
Sometimes their hair, they have spotting, their hair kind of falls off sometimes without them knowing. So yeah.
Oh, that's good. Yeah. So the like dry hair, dry scalp indicate there's medically something wrong. So like notify your nurse on duty, and they will inform the doctor, and then further test can be done. That's good. One thing, what are you gonna notice? Patients with who has been through chemo.
Hair fall problem?
Yeah, they lose their hair because of the chemotherapy, and most of them wear a wig.
Yeah.
It's very important to assess the skull if there's kind of any kind of cracks, any kind of dry, which is affected by the chemo medication. It's really important if you're doing with patients with chemo. Just before you put the wig on, assess the skin really good. Good. Physical and mental health. Sometimes there's some people, some patients you're gonna see they have the mental issue and they'd like to pull on the hair when they have the, especially clients who are have schizophrenia. When they get the dopamine level up, they start pulling on the hair because they get aggressive, banging the head on the wall. So assess all those things if there's any kind of trauma or any kind of like fingernail scratches. Those are really important. Any questions? Nope. So alopecia means the hair loss. Most of the time, if they go for, there's some medications, like if they are on any cancer medications that are toxic, they start losing their hair. It becomes dry, brittle, and they start. So when you're brushing, you'll notice quite a bit of hair onto the brush. That's pretty common, but do let the nurses know so that they can, find another alternative to keep the hair. Male pattern baldness occurs, and I'm one of the signs here. And if, yeah, so alopecia, make sure you remember what it means.
I have a question.
Yes,
So when you're brushing the hair and then the hair just keeps falling off,
yes,
you have to go tell the nurse, right? If it's just
yes.
like
Mhm.
every time you brush it and you just see big chunk of pieces coming with the brush.
Yeah, most of the time, that's a sign they are lacking iron in the body.
Okay.
Yeah, so if once you get used to a client who's on, you do care regularly, and all of a sudden you start noticing that they're losing lots of hair when you're brushing, that's something you should put a question mark, why? So they might have to send, most likely they will do a blood work to find out if they're low on any iron or B12 or something. Okay, that answered your question, Nia?
Yes, thank you.
So common skin and scalp conditions, alopecia means hair loss. Male pattern baldness occurs, aging or is hereditary. Sometimes it runs in the family. For some women, hair also thins with aging. So the older they get, that's part of the aging process. Cause of hair loss include cancer treatments, diseases, stress, poor nutrition, pregnancy, some drug like hormonal changes. There's a medication they give, if for the female, just offhand, to prevent breast cancer, and that also causes hair loss. So you'll notice. So just check what medications they're on. Okay. Hysterism is excessive body hair. It occurs in women and children who have hereditary and abnormal amounts of male hormones. You'll see quite a bit, like especially the clients you're dealing with are from the Asian background, like Indian background. Yeah, you're gonna see lots of excessive hair. Dandruff, we're all aware of the dandruff. Excessive amount of dry and wet flakes from, and then there's you can notify the nurse and they can order a special shampoo which you can use on the bath dish to wash the hair, and that prevents the dandruff. Lice is an infestation with small insect-like parasites. So we all familiar with the lice. Yeah, it's pretty common when it starts getting warm, like in the spring and early summer. So when you're taking care of somebody in that time, just keep an eye on it. That is infestation of scalp with lice. You'll see like a small redness. Some might have a little area that is inflamed. Proteus corpus is infestation of body surface with lice. And sometimes you'll see the lice glowing. There's a special light, they have it in facilities where you can just shine it and you can see if there's any lice. Okay, report and sign into the nurse at once. Hair care. Brushing and combing hair encourage the client and resident to do their own hair. The first thing we learn when we start the healthcare program is our main duty is to promote independence. So you want to let your client or your patients do as much as they can. It also prevents their dignity. Perform hair care for those who cannot do so. Client chooses how to brush, comb, or style their hair. It's their own preference. Brushing and combing hair, prevent tangle method and hair. Sometimes, like if you're brushing somebody hair, you feel the tangle. Putting a little bit of water on the brush, hair brush, will help with the tangling and stuff. Do not braid hair without the client consent. Make ask them. I said, do you want me to braid your hair or do you want me to tie your hair? What do you want me to do? So whatever they want, it's the specific. Never cut a client's hair unless specified, instructed. You probably guys know that during COVID, like most of the RCAs were cutting clients' hair because there was no hairdresser coming to the facilities, especially male clients. The hair used to get long, and they were pretty happy of it's being done. But make sure you can ask the consent from the family that is it okay if I cut your mom's, your dad's hair or trim your mom's hair. And then on the care plan, you'll see if they are on any kind of hair treatment, if they are on a special oil or something they're using for medication to prevent hair loss. Brush and comb hair whenever it's needed. It's just not in the morning, but if you see it get messy, just brush it and make it nice and neat. That also protects the dignity. So this acronym, make sure you guys know that. DIPS, dignity, you want to prevent the dignity, independence, try to promote more independence, set up their brush and everything by the sink and let them do it. Individualized care, make sure that, every patient, every client is client-centered, meaning that you're going to do everything different and everything with the each client differently, and make sure you provide privacy. So when you are doing the hair care, it is very important just to keep an eye on any kind of abnormalities you see, report to your nurse. Some of them are like scalp sores. You'll see like redness. Sometimes at night, the clients, they like to scratch the head. If it's too dry, they scratch it. And that, tears the skin. And that brings, infection and stuff. So keep an eye on that. Flaking, if there's any dry skin coming off. The presence of lice, oval shaped like, yeah. So the lice, you're gonna notice more when the weather starts getting warm. Many factors affect frequency, including the condition of the hair and scalp, hairstyle, and personal choice. And sometimes some of the medication they take, especially if they are on Lasix water pill, you're gonna see dry scalp. So just apply a nice lotion, or ask the family or the nurse to get you some really nice cortisone, dexamethasone, like Alvino is one of the good ones to apply to keep the skin moist. Tell the nurse the method to use. The shampoo method depends on client's condition, safety factors, and personal choice. Some of they have their own shampoo and supplies, but if there's a need, you can they can order the prescription one for the dandruffs and to wash. Any questions so far, guys? Anything you're not clear of?
So you're saying that they basically own their own shampoo and like conditioner and everything?
Yes. Even if you go on the facilities, they have their own preference and their family buys for them.
Okay.
If they need, if they have quite a bit of dandruff or some kind of hair condition, so the doctor writes a prescription, and then there are some prescription shampoos, like there's 3 or 4 different types.
Okay. That makes sense. Thank you.
Okay, now we're gonna go on to shaving. So make sure, like, any abnormalities you see, report to the nurse. Shaving. Shaving dips, remember those acronym? Many men shave for comfort and sense of well-being. Many women shave their legs, underarms, shave the coastal of the facial hair. Ensure that you are looking at the checking with the client or the nurse before you start shaving, because some men they it's a religion to have the beard. If you have a East Indian client who has a beard, make sure that you get the consent. Actually, this happened about 5 years ago. We had a new RCA that joined our team. I was at that time in the long-term care, and we had a Punjabi gentleman. He was one of them, and then she ended up trimming the beard and the mustache, which was a big issue. The facility almost got sued by the family, but then it was a learning for them. So that's why I always let my students know, before you shave anyone, check with the nurse that, hey, is it okay for me to shave him? Some prefer, like nowadays, having a beard is a common thing. So, there's some prefer to keep the beard, or they have some kind of a skin condition. If you're going to shave, they need a special lotion to be applied in order for them to be safe. So just be mindful. Anybody, before you shave, please check with your nurse. Once you get familiar with your own clients, then it's easy for you to know what needs to be done. But yeah, just that was a big issue, and I always share with my students that it could have been disastrous. Okay. Shaving. Manual razors, electric shavers are used. Most of the time, we request electric shavers, but 1 out of 10, you might not. So you might have to use a manual razor. If you're not comfortable using it, ask your coworker to help you. So manual razors are not used on the following: those who have healing problems. Like you can see, they have quite a bit of skin ulcers, dermatitis, redness on the face because of some allergic reaction. It could be like some medications they are on, like a Abaxaban or something like that, which would affect the shaving with the razor. So request the family to buy them electric razor. But 99% of the clients and the patients you're going to be seeing, they have the electric shaver. Soften beard before using electric shaver by just giving it a little wash with a little bit of shampoo. It softens the beard really good, and then it's not going to mustache and beard need daily care. Ask the person how to groom the mustache and the beard. If they have beard in the mustache, if they want trimming, there's lots of scissors, trimming scissors available. So you can just and also to shave, you have to have a consent from the patient. If the patient is not able to make their own consent because of some medical condition like dementia, and so ask the family if it's okay, and always document that you got a consent on what date, what time, from who. It's very important, because sometimes happen is the client might have multiple children, and some of them one would agree with you and the other one won't agree. And that could get you in trouble if you don't document that. Okay. Any questions on?
I have a question.
Yes.
So basically, let's say the client says yes at first, like they can speak for themselves, and then after you shave them, they go, "Oh, I never asked you to even shave it. Why did you do it?" Like, they start to blame you for doing it,
Yeah.
even though they said yes.
No, that's why I said always document it. You're gonna have access to the notes. Request the client at this time, and then also document that the client was upset. You are safe. As long as you document it, you are safe. If you don't document, and then the client comes and says, "Oh, I never asked you to shave," there was no proof that he agreed with you, then you could be in trouble. But always, always, always document. Remember, in healthcare, there's no documentation, it's not done. Okay.
Okay.
Yeah, but yeah, you should not worry about that if they say I didn't ask you. Nail and foot care prevent infection, injuries, and odors. As a caregiver, you're not allowed to do toenails. It has to be done by podiatrist or foot care nurse. If you see that there's ingrown toenails, it's getting black, that means there's a presence of fungus. If you even notice some odor from the foot, notify the nurse. There's medications available for those fungus, the foot odor, and there's some powder that comes in and you sprinkle and then put the socks on. But you are allowed to do the fingernails. Normally the fingernails is done weekly after the bath, the shower, and then the nails are done. It's easy. Never try to cut a nail when it's dry. Okay. Always keep an eye for any kind of blackness, any kind of on the redness underneath the nail bed, any toenails, any skin leaving the nails, report to the nurse right away. Long and broken nail can scratch the skin and slag. So most of the time, I've noticed myself is the nails are not done on time, and then when the clients are sleeping, they scratch the back or ingrown or the buttocks because of the dermatitis. There's a big skin tear, and that results into a wound later on. Because if they are diabetic and they're doing that, it's very hard to heal those. Like a small preventive injury could have been, it turns into a big problem. Okay, yeah, keep an eye for the odors, ingrown nails. Foot care and injuries occurs, stabbing toes, stepping on sharp objects, being stepped on, toes that they don't fit properly, shoes. And that's what happens is you have to really keep an eye on the edema on the lower foot, if there's any swelling or any kind of things, because the normal shoes they've been wearing might not fit. So you can ask the family to bring in like a different shoes which can fit. And compressing stockings, they are very hard. But if you guys come on there, if I'm here on the in your lab days, then I can teach you a really easy trick to put those on. Those are very difficult to put on. Any of you guys have ever tried putting the compressing stocking? No.
No.
No. Yeah, it's like elastic and it's really strong, and you have to stretch
Yeah, I
it.
tried putting it once on my own, not on someone.
Oh yeah,
Yeah,
those are
it's quite
difficult.
difficult to put it. Yeah, I can imagine it would be quite difficult to put it on someone.
Yeah. So there's a trick to it, and that I learned along my way, and I can teach you guys to make it so easy for you. So let's hopefully I can teach you someday. But if I meet you again, just let me know and I'll show you. Okay. Being strapped on, shoes, poor circulation, prolonged healing. Sometimes you're gonna, like, it's really important, like if you see any kind of bluing, uh, uh, any black gangrene on the lower extremities, those are the signs of poor circulation, especially people who are diabetic. And also they, once you start seeing any blackings around the skin and around the toes, report that to your nurse on duty right away. That could be sign of that there's not enough, there's a blockage and there's not enough blood flowing. You guys know what cyanosis is? Have you ever heard of the word cyanosis?
Is it a nose problem or something like that?
It's the bluing. Your lips gonna go blue, the fingertips gonna go blue. That's mean lack of oxygen. CYSISO, cyanosis. So it's very important to keep an eye. If you see that, that means that person can go into cardiac arrest, can have a heart attack in any second. So that's a very important when you're doing care or even walking by. If you see this top of your lips going blue, that's the code blue. Okay. You guys can stop me if you have any questions. Okay. Trimming and clipping toenails can be easily result of injury. So that's why I said, as a caregivers, you guys are not, nobody's allowed, even the untrained nurses are not allowed to do the toenail. If somebody, especially who's diabetic, it has to be done by a foot care doctor, podiatrist. And then there are some nurses who, after they graduate, they take the extra course to learn about foot care, and they are the ones who can do it. And most 90% of the time, you're gonna have they come once a month and they have their own clients and their own patients, then they do it. Okay, and if you see like that, anybody who does need the foot care, let your nurse know. They can get a consent, because they charge, I think they charge right now would be $60 per visit, and that it's not covered by BC Health, so they have family has to pay for that. So check the client's feet every day. Observe for very dry skin, foot odors, cracks and breaks in the skin, especially between the toes, ingrown nails, loose nails, red and irritated cell cones. You know that what casellose means?
What is that?
Cone. Remember those? You get little cones on your foot.
Cones?
Yeah. Yeah. So sometimes, like, you'll see, it's they, in common term they call it cones. So there's a little you get a little plaster and you apply on it, and then that gets rid of it. Have you ever had cones? Heard about cones?
No.
Yeah. Have you ever seen a wat?
A mott?
A
No.
wat, WH8.
What? No.
Yeah, it looks, you'll see it like when you go, it's like a little mole that comes up and scaly. So you can just Google it and then you'll see it is dry and you'll it's not that common, but it is, like, you'll see that quite a bit too. Okay, drainage and bleeding, change the order of texture of nails. So if you see any nails that is black on top, that's a sign of this funguses. So make sure you let the nurse know so they can order, the doctor can order some antifungal nail polish, and you just apply it. Okay. Because that is crucial, because if it ends up in the bloodstream and goes to the liver, that can cause the liver cirrhosis, and then the person can die from it. changing clothing, incontinence brief, and hospital gown. So do you have any question on nail care? Nope. Pretty good. Okay, we'll move on.
Yeah, excuse me. Like, if a person has a broken nail right now, so do we put a bandage, or we notify the nurse and then put a bandage, or we allowed to put a bandage so it
No.
doesn't get
No,
more slapped up?
notify your nurse. They say, yeah, I was doing the morning care and I noticed Miss Jones' nail cracked. So they will do
Okay.
assessment. Why is the crack happening? Is it she's not drinking enough fluid, or is there a trauma, or something like that? And if you're gonna, like, on a normal day, just soak the fingers in a little bit of container, warm water, and soak the fingers. Sometimes it's just because it's so dry, it will crack. That answered your question, Amar?
Yes, sir.
Yeah. Any kind of dressing, any kind of medication, the RCAs are not allowed. Any prescription you can do on like over the counter, like lotions, some dermatitis creams, but anything that has a prescription has to be done by the nurse, because they have to assess before they apply. So changing clothing, incontinence, and brief, and hospital gowns. So what's the most important thing when you're doing the changing the gowns and stuff? Provide privacy. It's very important, especially if you end up in a hospital setting in acute, because in a room there's four different patients, and each ones they have their family coming in, and make sure the curtains are closed when you're doing the personal care. Changing the gown, changing the brief is really important, because people will be coming in and out. And in some of the long-term care, they have a shared room where there's two clients in there. One might have the family sitting there, and the other client, you might have to change the pads and make sure that the curtain is nicely closed. And if you feel, if the family is present, you can ask them. I say, you know what, can you step out for a minute? I'm gonna change, and then let them come in. So it is just the your patient is your most valuable asset in there, and you're never gonna get into trouble asking a family member, or even if it's the husband. They say, no, can you step out? I don't feel comfortable changing here when you're sitting here. So once I'm done, you can come back right back, and you're never gonna get into trouble for that. So you may need to be assisting with changing clothes, incontinent briefs, and hospital gowns. Following make the most important thing is provide privacy. Encourage client to do as much as possible. Give them a wet the towel, and just tell, okay, you can wipe your face, you can do whatever they can. They can, and then whatever they are not able to do, then you can assist them with, doing the personal care, especially, back. And what's the most important thing? Can have anybody else when you're doing a personal care? What is the procedure for doing the care? Any of you guys tell me? When you take a shower, put yourself in the mind how you do it. It's a special.
We have to ask them, or we have to let them do on their own if they can.
Yeah.
It's independence
Mm-hmm.
of the client.
Yes, promote independence, and plus you're always gonna do from clean to dirty. So which is like face is a clean part. You're gonna do the face, the body, the back, the legs, and then they're gonna do the perineal area. But that's the last, because that's the dirty area. You're gonna do the front and then do the buttocks. And then that's the way you're gonna end your care. Always remember, from clean to dirty. And just when you're taking shower, just think, well, which part of the body you wash last. And same thing applies when you're doing the client. Okay? That's a little tip from me. I've seen some carry, like, going in and start washing, put the client naked on bed, and they start washing the front, bottom, they sprinkle water, and then they wash, and then they do the back with the same towel, and then it has a little bit of BM in there, poop in there. They had a little bit of incontinence during the night, and they wiping with the same thing, the back after because the way they are rushing, but because you have a towel which has BM on it, bowel movement on it, and then you wiping it the back with that. Like, would you do that to your mom, or would you do it to yourself? So, yeah. Okay. So let the client choose what they want to wear. Sometimes they said, okay, ask them, okay, give them two choices. You want to wear this pink today. Today is a nice sunny day. You want to wear red. Just give them the choice. Remove clothing from the unaffected side. Remove from if unaffected side first. So they might have had a stroke. And then if they have, it's going to be most of the time, it's you're going to have two people coming in, somebody who is paraplegic, quadriplegic. It's one person cannot do. It has to be two people. It's the healthcare WCB law. And also remember that if it says on the care plan is 2-person, don't never attempt to do it on your own. It just happened with one of my co-workers last week. There was 2-person left. She was supposed to wait for the home care to come in to assist her, and then home care was running late, so the client was getting really agitated, and she tried to get him up on the own, and she hurt herself. The client the lift started swinging, and she tried to grab the lift, and this client was about 300 pounds, and she damaged her back. So I did the report, and now the WorkSafe BC won't cover her because she was supposed to wait not to do it by herself. Now she's injured. We don't know, 3 months she's gonna be home with no money. So that's something I want you guys to always keep in your mind, because WorkSafe will find anything not to pay you. So just always keeping that in mind. Support the client's arm and leg when removing or putting on the garment. Changing to hospital gowns are usually worn for IV therapy. Sometimes when some of the clients who are bariatric, you know what bariatric means? Big. Any client who's over 250 pounds, 50 pounds, 120 kg, I think, yeah, is considered bariatric. So that means they're big. I've done a client who was 700 pounds, 380 kilograms. You're gonna get some periodic. So we always put the hospital gown on them because it's easy to do the personal care, especially at night, because the way you put the tanning sling and everything to give them personal care. So always put them in hospital gown.
Wait, you said you worked with the client that was 700 pounds?
Yes.
So how did you give them personal hygiene care?
It was two of us always. But he was big, he was able to move himself in bed. Like if you ask him to go on your right, then he does, and then we wash it, then he goes on this left, and then we put the big briefs, and these lifts were all designed. And when he's sitting in the wheelchair, we just leave the sling. We don't remove it. And he was full lift.
Okay.
Yeah. So you always have like you're gonna have like 3-person assist. So somebody big like that who is not able, like you'll see some of them have below knee amputation, which is they had some kind of diabetic or something, and then they took their legs off, and they don't have they have nothing below the knee. So those ones, they cannot move. So you need 3 people with special equipment will be in place. And most of the time, you're going to see those bariatric, they are young. They're in their early 30s, 20s. Yeah, we just admitted a female client, which is she's about 500 something, 26 years old. Because yeah, so now she's on a special diet and a 3% assist. Okay, guns are usually IV, snaps, or Velcro. Most of the time we don't get the Velcro, we get the string, and sometimes standard gown are used. If there's an injury or paralysis, his gown is removed from the unaffected arm first. So this depends if you end up in home care. You might run into clients who are who's been in a car accident, and you provide the home support, and they are mostly in their own home. So we will help, or sometimes it's just somebody who's about 110 pounds, so you might not. So just remember, try to, they will probably be able to direct their care on to let you know what they need done. Okay? Read the care plan very carefully before you go to a client first time. Any questions, just double ask, double check. Okay, you guys are okay so far? Yeah, you can stop and ask me any question, because I worked in hospital, I've been home care, I've been in long-term care. So I have lots of different things I have done, so I can share my knowledge with you.
For home care, it's only you, right? You don't have like a second hand person that's gonna help you?
No, if the charge nurse, which is the Fraser Health or Coastal Health charge nurse, when they come and do the care planning before they discharge them from the hospital, if they say it's 2%, it is 2%. So you're gonna have somebody coming with you to go and do this client.
Okay.
Yeah. Whatever this like OT, PT, they the ones who make the like the care plan of transfers and stuff. And if they say it's 2% assist with transfers, then there's some second person will be with you.
Have you ever worked with like at the psych, like people that have mental illness?
Yeah, I've worked with many, because you guys know, like about 10 years ago, they closed on the River View Hospital, and most of the patients were sent into long-term care. I worked with schizophrenia. I've worked with bipolar, psychosis, even as young as 14 years old. I've worked with and also post-traumatic stress disorder. We had a whole bunch of girls that came out from Somalia at that time. They were put in the long-term care because they had the PTSD. The parents were killed in front of them. They were raped. They were like sexually abused by the rebels. And we had quite a bit. Like I remember when I was going there to do the assessment, there were like 20 of them that came. They were placed in long-term care around Lower Mainland. So you're gonna see, yeah. But there's a good medication, like for schizophrenia right now. There's a medication called Risperidone Consta. They get that injection once a month, and trust me, they are like a normal people. So there are some really advanced drugs now for the mental health. That answered your question, Nima?
Yes, it did.
Yeah. That was a really good question.
Thank you, sir.
So stocking and bandages, you never, like stockings, yes, you're gonna do compressing stocking, or there's a TED stocking, or there's a edema aware. So these are like all different you're gonna be doing. But if there's any bandages that needs to be done, make sure you let your nurse know. Don't do the bandages because it's not in your scope. These items must be applied as a part of client's daily dressing routine and are used to prevent blood clots, thrombus. Okay. Thrombo is like a blood clot that happens mostly in the lower extremities. It's the like if they had a internal bleeding, the clots, and if it gets discharged, like if it breaks, if it ends up in your heart, the person will die because it's going to block the pulmonary artery or pulmonary vein, so the blood is not circulating to the lungs and back to the heart, and the person can die. And I've seen one death in my career from thrombus, and I've seen it like when on the tongue, it was like a big slug, like it was this big, and it came, and then she aspirated, and then that's how she died. So those things, yeah, anything like in the circulation, because if you make it too tight, it will cut off the circulation, and if they have thrombus, if it breaks. Okay. So bandages, I wouldn't suggest you guys to do it. Just let your, like whoever nurse on duty is, just tell them, are you not comfortable doing bandages? Doesn't matter what kind. If it's sometimes it's a neck one, yes, you can put because that's already preset. All you're gonna do is put in the neck and put on the Velcro. You can do those. But if you have to bandage because somebody has a problem with the arm, don't do it. Yeah. Because yeah, this is very, very dangerous if the thrombus, a blood clot thrombus can be formed in the deep leg veins, break loose, travel through the bloodstream and lodge in the distended vessel, and the person can die. You know, the medication that used to change is heparin. So that person has to, if you notice like on the lower leg, they call it vargus vein. It's going to be a thick vein, like you're going to see like distended black veins along the lower part underneath the knee. Let your nurse know right away. They might have to go into the hospital to get a IV heparin. Okay. Yeah, elastic stocking, I already talked about that. That's also known as compressing stocking or edema wear. They're very hard, but there's a trick to do that. So there you'll see it check in the care plan. They applied in the morning and how long they have to be. Some of them are for has to be on for 8 hours. Some says apply in the morning and remove at bedtime. It's all different and depends how severe the edema is. The client remains in bed when the stockings are off to prevent the swelling of the legs. Wash stocking and hang it. Make sure you always hand wash it. Don't throw in the washer because the hot water will damage the elasticity. And then one stocking is good for about a year, and then they have to get a new one, new set, because it loses the elasticity that pumps while they are working to push the fluid back up. Just soap and water. When you remove it, just hang it in the washroom to dry. Elastic bandages, I wouldn't suggest you to apply this. Let your nurse know that are you not comfortable doing it, because if you're gonna do it the wrong way or too tight, the person can lose circulation, and that part of the leg within 2 hours is gonna be dead. Yeah. It takes 2 hours if you apply too tight, the elastic one, because they come in a Velcro, and if the circulation is gone within 2 hours, that part of the body is dead. So never do that. Skin color and temperature is very, very important. As I know, cyanosis, bluish. Temperature, if you touch the lower extremity and it feels warm, like more warmer than normal, or notify your nurse. What for edema, leg and foot swelling, ankles. If you see any kind of swelling, let your nurse know. Skin breakdown, right? You know that sometimes they hit some edge. If they're in the wheelchair, sometimes they hit the corners of the walls. And also it's very important if they complain of pain, tingling, or numbness. I'm going to ask you, if they complain of pain, tingling, and numbness, do some brainstorming. What would be the sign of it? What kind of do you think that's a sign for?
They're complaining about pain and numbness, you said?
Yeah, pain, tingling, and numbness. What is the sign and symptoms of what condition?
Maybe diabetic.
Huh?
Diabetic.
I didn't get you.
They might be diabetic. Like
Yeah, diabetic, and what could cause if they are diabetic? You're on the right track. What happens when somebody is diabetic? What happens to the blood?
it doesn't clot.
Yeah.
Yeah.
Now, so if you put sugar, what's going to happen to water? It's going to go thick, right? Syrup.
Yeah, the blood gets.
Yeah. So that means the blood sugar is high, and the blood is thick because it's like a syrup. So there's a slow down of circulation. Yeah, that's good. You're on the right track. So just remember that that would be sign of the blood going thick. That means the blood sugar is high and there's poor circulation. Good. Another thing it could be sign of a stroke. There's a pre-sign that somebody might be getting a stroke because there's a blockage and the blood is not flowing to that area. You're gonna get pain. Pain is our body's defense. The pain tells you there's something wrong. Tingling because it's gonna tingle because those cells are dying. They're not getting the nutrients and the oxygen. And numbness, that means the cells are dying. So that is very crucial. At that stage you can prevent a stroke. If that person has a congestive heart failure or any kind of condition, if there's complaint, right away call the nurse. And let's tell, okay, this client is complaining of this, and I got a feeling it might be related to stroke because within about 2-3 hours, that person can have a stroke. So keep these two in mind. First one is diabetes because the blood sugar is high. If it's too much sugar in the blood, guess what? It's gonna get thick like syrup. It's not flowing properly to the lower extremities. That means so they need to check the blood sugar and maybe give the insulin as needed. Okay. It's not in your cover, but this was something I just wanted to let you guys aware of. Providing compassionate care when helping and grooming and dressing, focus on the whole client rather than only on the task you're doing. Remember DIPS. Did you guys ever had that work, a holistic approach?
Are we allowed to take the holistic approach?
Yeah. What is holistic approach? You guys know about that? Okay, I'll give you 10 minutes. It's very important. And then what time you guys normally go for a few minutes break?
We normally go at around 10-15.
So how about I give you 10 minutes, find out what is holistic approach and what is the circle around it. And then you can go for break. When we come back, we'll discuss that holistic approach. It will help you to understand what it means.
What's a holistic break?
Sorry?
What do you need us to find?
Holistic approach, what does it mean?
Holistic approach.
Yeah. Always, that's something you should keep in your mind all your life until you work as a caregiver. Holistic approach. There's a holistic approach. There's I think 4 or 5 factors that combine to make it a holistic. Okay. I'm right here if you have any questions. And then after that, you guys can go for your break. also when you find that the approaches, if you guys can come up with some examples of what way you can use that holistic approach in providing care for your clients. Okay, and I will discuss it after your break.
He got enough to look at. He don't need to look at nothing.
Okay, I'm back. So, did you guys find out what it is? Holistic approach? Nima is back?
Yeah, I'm here.
Okay. Can you turn your camera on? At least I know I can say hi to you in public.
My camera doesn't work. I tried it, so I only can just be off mute.
Okay, no problem.
I'm here. Don't worry.
I never know if you woke up to me in Fraser Health, I might hire you.
Okay, hopefully.
Yeah. Okay, so holistic approach. Let's discuss. What is holistic approach?
Um,
Yeah,
when
it could be like providing support and care for our client as a person, like rather than no, like what we think is mostly we focus on treating their illness. Like let's say the patient is a cancer patient, then instead of like treating the person as a whole, like providing no, like I made a mistake, sorry, I misunderstood. So I think we need to provide care and support as as a healthcare assistant, we should like focus on their well-being, physical, like their culture and everything, instead of just focusing on their illness. Yeah.
Very
Okay.
good. Yes, very good. Anybody has something else? Mr. Singh?
A different approach from the allopathic medicine, taking care of the emotional needs of the person
There's nothing,
regarding his.
yeah, nothing to do with the holistic approach, is nothing to do with medication.
Okay, like treating the person with like other spiritual, emotional needs, emotional well-being, with family values, heritage, culture differences.
Mhm.
Just treating the person individually, not treating all the persons same as like they are old, but respecting their dignity, individuality, basically.
Awesome.
That
That's
terms
good.
as a whole.
Yeah. Because, yeah. Nima, what do you have for me?
So basically you just need to provide them with support, and that like you don't have to just treat them like a patient, like, don't treat them like, oh, they're sick, just treat them like a patient, someone that you could take care of. And
Mhm.
basically they have like physical, emotional, and like all the type of illnesses, like social, emotional, and mental, and environment health, all of those.
Yes. Okay. So yeah, that's good explanation, guys. So when you providing care, just don't be task focused. Just say, okay, I have to do this, get out. You treat it like how your patient is feeling that morning, if they had a good sleep, is there something you can support them emotionally, if they you can if they are getting depressed because they don't see their family, give the family a call. Hey, I noticed this morning that your mom was kind of depressed because she was saying that they haven't seen you for a while. Maybe you guys can make a plan to come and visit. So things like that. It's not just provide the care, do the grooming and out. Make giving them emotional, environmental, all kind of support. Good, guys. Always keep this the holistic approach with you until you retire. Okay. So when helping with the grooming and dressing, focus on the whole client rather than only the task. This is what I've been focus on the like a therapeutic approach, uh, uh, a holistic approach, rather than just, okay, I have to do this and then I'm gonna be out of here. So just keep that in mind. Care for wigs. You're gonna see this. That some of your clients will have the wig. They are worn on a variety of reasons. Some of them have 2 to 3 different types, and they wear for different occasions. Especially when there's a pub night, and if you end up in a long-term care, they have a weekly entertainment. They like to put in the fancy wig because they want to dance. So you're gonna see quite a bit of those. Generally, wigs are washed 6 to 8 uses, and just they depends. There's some of them have spray. You just spray it and just brush it. Dry wigs with towel, bloating, and hang it to dry. And you might see maybe in 500 per patient, maybe one with a wig. So this is not that common, but at least you should know how to care about that.
Um,
मैं बात कर रहा हूँ उन लोगों से क्वेश्चन सवाल कर रहा हूँ कोई बोलता नहीं मैंने बोला क्या बोल
नहीं, it's working. Yeah,
yeah you can see them but then they can
they cannot see.
oh no they
It
can maybe
froze up. It froze up, but it's good now.
oh yeah okay now it's back
Okay.
yeah chapter 19 World Cup.
All right.
I'm used to the old school.
No worries.
That students.
We'll invite all of them in class.
It's nice when I run into them occasionally in the field. So
Right.
nice. The students at talk.
Yeah. Oh, yeah, they're here now. But
That's right. It's 1:30 class.
yeah.
Let them review this 18. Maybe the internet froze for a few minutes.
There are a lot of possibilities. Again, it's a Microsoft, so anything can happen.
Okay.
Okay, let me close the door.
Okay. So, do you guys have access to your textbook?
Which one? The big one?
Yeah. Which one is this? Textbook for support workers.
Oh, I don't have, sir. I left it in the office.
Okay, never mind. There's some, whenever you get it, if you turn to page 349, there is the cross-section of a skin. And it will, just review, there's like how to do a shaving, all these things. Just the basic stuff, just review it.
Just to review, okay, we have two textbooks, one to write in the things and then one to just read it.
No, the ones to read it.
Okay.
Page 349.
Okay.
And there's like what you need to watch for and things like how a cross section of our skin, like dermis, epidermis, subcutaneous layer. I don't know if you guys will need to know about those pressure source. It might come up a little later in the curriculum, like how to stage the pressure source. Okay.
Okay.
Yeah. Because if you let somebody lie on one side for more than 2 hours, the skin gets trauma, and they can easily start a pressure sore, which can be disastrous. There's 5 stages of that. And if you see any redness or any bulging on the skin, report to the nurse on duty right away, because that can turn into a chronic wound. And that can won't be healed. So, do you want me to explain a little bit about pressure sores, or you guys want to wait until you go? Let's see how many slides are there on the next one. Okay, there we go. Okay, so you probably heard about this pressure sores or pressure ulcers. These are common thing happens when a patient or client lays on one position for prolonged time, which is more than 2 hours. So and then that area can get trauma. So stage 1 is when the skin underneath gets damage because of lack of circulation. And if you're not going to take care of that right away, you can, reposition, get some therapeutic measure like ROHO's silicone mattress or air mattress that can prevent that from moving to stage 2. And in stage 2, what's going to happen is that top layer of the skin, the epidermis, is going to break. And then you will be able to see the subcutaneous layer. It's going to be a round pressure sore. So it's going to be stage 2. So now that area which was closed is open now. And then if you can still heal that, but if you don't try to look into that, like, changing positions, doing dressing on time, then it becomes stage 3, where the whole layer of subcutaneous layer is gone, and now you can see the flesh, which is stage 3. And a stage 3, it gets worse. So what stage 3 is, if the bacteria goes inside and goes in the flesh, it can go to the bloodstream, end up in your heart, and you can get a condition called carditis, which is sepsis, and person can die from it, especially if that wound is on the coccyx, where the coccyx area is, right on top of your buttocks, like where the spine ends, and the bum, that area is known as coccyx. Most common, it happens on that area, 99% of the time. So guess what? If you get the flesh in there, what is the bowel movement, right? And our bowel, 1 ml carries 1 trillion bacteria. So it's so close to the, if that patient is incontinent, like they go in their pads, guess what? They're lying close to the bowel movement, and those bacteria are getting inside. So from there, they can die from sepsis. You probably had, like, in your family member or somebody, oh, one of my family had a sepsis and they died. This is what happens. And then when it goes if you still don't take care of it, you can still heal that from muscle. You do regular dressing changes. There are some really good dressing available out there. You can heal that. But when the whole layer of the muscle is gone and you can see the bone, that's called stage 4. And stage 4, you cannot heal it, because there's nothing around that wound that can multiply and heal it. And I've seen, like, you can see the bone, your spine through it. And sometimes they are like 3 centimeter to 5 centimeter opening. So those becomes a maintenance wound where you're going to be capping, like pushing. Right at the moment, the health authority, they spend almost $30 to $40 million just to manage the wounds, which can be prevented at stage 1. So that's why it's really important to make sure that when you to reposition your patients. Okay. They can also build, like, develop MRSA, which is really bad. Any questions? Nothing? You guys all look tired. Okay, so let's start chapter 19. Infection control, which is infection management. You guys have access to the key terms? No? Key terms of chapter 19. No? Okay, I'll go over and you guys can take note for the most. I don't have to go for all of them, but there's some really important. So asepsis. It's the practice of reducing elimination of partial pathogen. So asepsis is you want to prevent and practice infection control to prevent from the bacteria of spreading. Right now, most common thing we're doing right now, can anybody say the most dangerous thing going on right now? COVID. So what are we doing to prevent it? Regular hand washing, mask.
Marks.
So that's prevention. That's what it's asepsis. Is you preventing the virus, virus or bacteria from spreading. Okay. You know what a bacteria is? Curious. Curious means a person who's carrying the pathogen, but they don't have any symptoms. You or me, anybody could be a carrier for COVID virus, but we don't have any symptoms. We could be just carrier. And once our immune system goes weak, guess what? That takes over. So it's very important to prevent anything, to keep yourself hydrated, well fed, keep yourself healthy. C. diff, which is also known as Clostridium difficile. It's a kind of bacteria that affects your GI system. You probably heard there's a C. diff outbreak in Langley Memorial, just like it always in the news. It is a bacteria that goes on your GI system, and it's very contagious. So if one person gets it, it's really easy to go for the next person, and the person will have, like a patient has continuous diarrhea. It's like every hour they'll have diarrhea, and trust me, I worked in a unit where there was C. diff outbreak. It smells like a dumpster, and it's really easy to catch that. Okay. And normal flora is a good bacteria in our body that helps with your digestion. It helps with your body with any kind of bad bacteria. And the people who don't have normal flora, you can acidophilus. It's artificial capsule enzyme that you can take. Communicable disease that caused by microbe, which can be spread. Communicable means that if it can be transported to somebody else in a really easy. The 4 way you can droplet, touch, airborne, and what else is contact. So these ways that, for example, COVID, they said it's contact precaution, but we don't know, it may be airborne. So it's really good to always wear a mask in public right now, because there's cases has gone up. C. diff is contact and droplet. So if you drop up like a little bit of pad when it changing or helping somebody, that bacteria can multiply in no time and can affect someone. Like TB is airborne. It can be transported through coughing, sneezing. Disinfection, means that, where you're wiping with the proper heavy wipes, antibacterial wipes. Hand washing, hand hygiene is very important. Yeah. So what an incubation period is, how long it takes the bacteria to reach its maximum incubation, like how long it takes it to grow. So these are part of the chain of infection, which we will discuss it later. Influenza, you guys know, it's a common thing right now. It's a flu season. It's a longer term for flu. And reservoir in an infection means where the bacteria will live. Sometimes they'll live for years and years, and then all of a sudden they find the proper thing, and then they get out of the reservoir and affect everybody. There's two types of practice in infection control. It's called standard practice and universal practice. And we'll discuss that in detail. Sterile is there's a universal, and there's universal where you use everything sterile, which is a sterile technique. Tuberculosis, you guys all familiar with TB? There's a condition called VRE. You might have, like, you at work, somebody says, oh, there's a VRE. It's called, this vancomycin is an antibiotic that's used for severe infection like C. diff, like severe wound, sepsis. It's called vancomycin resistant endococcus. It's a kind of bacteria that is resistant to any kind of antibiotic. And there's another one called MRSA, which is methicillin-resistant Staphylococcus aureus. That's why you probably notice that doctors, when the little babies, the kids get sick, they don't prescribe antibiotic. So that's that reason why, because your body builds the immunity to it. So when you go older, those antibiotics doesn't work for you anymore. So if you can manage without taking antibiotics, do it. Okay, so you guys all ready to go for the next chapter? Good. Okay, so infection is a serious safety and health hazard. I'm just gonna zoom in a little bit more. Yeah, serious. The healthcare team follows certain practice and procedures to prevent the spread of infection. And this is known as infection control. Policies and procedures to prevent the spread of infection within healthcare setting. You guys probably all familiar like with this, how the hospitals and everybody were using to prevent COVID from spreading. It was a worldwide pandemic. They shut down the borders, they shut down the travel. That's how they were trying to manage it, to control it. Maybe you're gonna go in end up in a long-term care where there's most common is influenza, flu outbreak. So you're gonna be using the universal precaution where gowning, gloving, and putting in the proper taking care of your resident coming back, removing them the proper procedure way, and then doing it. And then one of your skills testing for this curriculum is donning and doffing. Donning is how do you apply put on the gowns and stuff, and doffing how you remove it. So this is gonna be a skill test. Okay. And we'll go over in the details, and you guys when you have the lab, you can practice that. It's very important because that's gonna last you all your life. Infection control protects clients, residents, visitors, staff from infection. It does not. It protects everybody because you guys have families. When you have outbreak at your facility, you don't want to carry that and bring it home. During COVID, like I worked the front line, and I didn't go home for almost 2 months. I stayed in the hotel where the government provided us. And even after that, I always leave pair of clothes, my bathrobe in the garage. So when I came home, I would take all my clothes off in the garage, put my bathrobe on, and then go upstairs and take a shower right away before I touch anything in the house. And that clothes were left in there, and I used to sterile wash it. So that's how I prevented from my family from getting any kind of infection. So even though if you have just influenza, you have C. diff, use plan yourself, like how you're gonna come home, not to bring that home. Change of clothes, change at work, and everything. Proper hand hygiene is always accompanying for infection control. Hand hygiene is the most important thing that kills the chain of infection, that breaks the chain. And there's a proper way of hand hygiene, which you're going to be taught. And you're supposed to be washing the hand until you sing happy birthday all the way. And once you start doing that, even at home after your dinner, you're going to be washing your hands the same way as you do in the hospitals, because it becomes a habit. I got a question. A drop of sanitizer and you rub your hand. Is it same as performing a proper hand hygiene? No, because sanitizer is temporary, it just kills the surface bacteria. Proper hand hygiene, washing with the antibacterial soap will end the chain. Good. Who is at the risk? Let's discuss this. Who are at the risk of getting infection?
Older people and small children, babies.
Why say small children?
Maybe because their immune system is weak.
They have the strongest immune system.
Oh.
Their body will develop so fast to fight any kind of older adults, because as the aging process, all the immune system, the defense, everything is down. But if a child gets it, they can fight in within a day.
And then sick people are
Yeah.
likely
Sick
to.
people who are immunosuppressive. You know what immunosuppressive means? People who have like certain conditions where if they get sick, their body won't be able to fight, like somebody who has cancer, because they have reduced white blood cells. Somebody who has leukemia, someone who has osteoarthritis, where there's a conditions where, because if somebody has osteoarthritis, the bone marrow does not produce enough red blood cells for the body to carry oxygen and stuff. So the immune system is weak. Any kind of immunosuppressive means that whoever is prone to catching infection. So those people are placed in reverse isolation. Reverse isolation means that they have been protected from you going and providing. So they'll be in a special unit with the reverse air. So these things I want you to write down and just on your own time, just look into it, but because it will help you understanding when you go, what is reverse isolation? Okay. So yes, people with disabilities. So older people are more because the immune system is gone weak. But a child is if they catch an infection within a day or two, they will find a way to body will find a way to fight it. This infection can easily spread from person to person. Like right now, the most common thing came elbow shake. I never shake hands with nobody, because you don't know how, if that person has washed or they have put them on the face, what is on their hand. First thing is elbow shake. And yeah, that's how you're touching somebody who's contaminated with bacteria. They sneeze, probably they put their hand, you're shaking your hand and you get it on you. You touch your face, there. Okay. A microorganism. Microorganism means that something you cannot see with your normal eye. You have to look under the microscope in order to see. The commonly known as microbes are sometimes called germs or bugs. It's a living plant or animal seen with the microscope. Microbes are everywhere. Some microbes are harmful and that can be used as infection. So microbes are like, if you swab your hand and test it on the microbe, there's microbe, but those are good microbes. Bad microbes, you don't know. Any questions so far on microorganisms? Non-pathogens are microbes that do not usually cause infection. The most common one I just mentioned earlier, can somebody let me know? I just mentioned earlier, there's a good bacteria. Normal flora. You're going to swab it, you're going to see on your body, but it's good. It's one of the good bacteria. That's why you're going to find those in yogurts, yeast, cheese. Those are good bacteria. Microorganisms, there are 4 major types of microbes. Bacteria are one-cell microbes. Virus invade living cells in order to grow and multiply. Fungi are the live and on organic matter such as plant and animals. So bacteria, when they find a place, if you have one bacteria within, I would say 2 hours, you're going to have 1 million. Because they apply, they multiply. Have you ever, high school, remember the process of binary fusion, amoeba? They will just go, one cell will divide into 2 and that's 2. And then those 2 divide into 4, 4 divides into 8. They just split the cell. And that's why like if you have bacteria, that's called incubation period. It's how long the bacteria gets into number to colonize, to take over anyone's system. Virus, they go inside your cell, they sit there for years. And when your body immune system goes weak, weather changes, like it's getting cold now, your body immune system goes, and guess what? They split and they colonize your body. Fungi are like living things. You probably notice on your patients, you're gonna see some around the peroneal area, they have some redness, and it's fungus lower leg where there's moisture, because fungus needs moisture. And they will prescribe some cream, like the most common over the counter is Lamisil, and they use those kind of, and they are very contagious. So if you know someone you're treating who has fungal infection, just be 200 times careful, because if you touch your glove anywhere in your skin, the fungus will go, and then you're going to start getting fungal infection. Parasites are organisms that derive, like, mostly they are like hookworms, tapeworms, lice. They invade their living things, and they will invade your body, and they just stay there and feeding off your nutrients. Have anyone seen a tapeworm? Have you ever seen one? Yeah, tapeworm, hookworms, they are pretty nasty. And some of them, they can grow up to 20 to 30 centimeters. Yeah. Yeah, I've seen one time, this was a pretty long time ago, I had this client. He went on holidays, they came back and he was having his stomach problems. And then we put him, and then when he had a bowel movement, there was about 30 centimeter long tapeworm came out. Because they put him on medication to kill that. And so I was surprised because the first time I've seen that long a tapeworm living inside your body. It's pretty scary. And how can you get that? Is like from vegetables. If you don't wash them properly, they are present in the vegetables, and you can get it. It's just going to be an egg of tapeworm goes inside, sits in your stomach and sucking off your blood inside your colon. So microbes need water, nourishment, and reservoir. The reservoir is where they sit. They need nourishment, and they need moisture, and that to thrive. So if you, that's called a chain of infection. So if you take one of them away, the bacteria won't develop. Microbes won't. So not bacteria, microbes won't develop. Most microbes need oxygen to live. The warm and dark environment is needed. Most grow best in body temperature, and they are destroyed by light. So if you what do you call take a daily bath, you're washing those microbes out. You can go out in sauna or sit in the tub because the heat kills them. As I mentioned, reservoir is the host. Microbes need water and nourishment from the reservoir. Most microbes need oxygen. If there's no oxygen, then they might, and there are some microbes that it's called aerobic, which can grow without oxygen. See, normal flora. Microbes that live and grow naturally in certain areas of your body. This guy, like in your tummy, it helps to digest the food. On your body, it helps in digesting of the dead skin. They do many things. They are non-pathogens when in a natural reservoir. They don't harm you. When a non-pathogen is transmitted from its site to other site or host, it becomes pathogen. So sometimes if you have like a bacteria, and if it goes to somebody else, transports, that can become a pathogen. Pathogen means it can harm you. It's going to make you sick. Non-pathogen is when it cannot harm you, cannot make you sick. When a person is ill or taking medication, some normal flora can be killed, which increases the risk of developing infection. So that's why if you have anybody on antibiotic, any of your patients, any of your clients on antibiotic, you want to hold and try to give them more probiotics, like yogurt. There are some probiotic drinks, because when they're taking antibiotic to destroy the bad pathogen, it also destroys the good bacteria. So that's when you're going to see somebody on antibiotic having diarrhea. It's pretty common because it kills the normal flora, which helps with the digestion and formation of the, and they will have like emesis, throwing up while they're taking that antibiotic because it's destroying the good bacteria, and body tries to fight it naturally. Okay. Multi-drug resistant organism, MRO. Remember those acronyms, because sometimes you're gonna have your care plan, it says MRO. So what MRO means is multi-resistant drug. Those are the people who are always on any small thing, they go have antibiotic. So what happens is your body builds resistance to them. So 9 out of 10 antibiotics won't even work for you. There's MRO, multi-resistant MRSA, methylene resistor Staphylococcus aureus, and VRE, vancomycin resistors. Remember this, all these acronyms. So when you're reading a care plan, then you know what it means. The microbe that can resist the effect of antibiotics. Antibiotics are given to kill microbes that cause infection. So all of you guys probably have experienced antibiotic in your life. Sometimes it's best not to take antibiotic, let your body fight it naturally. Doctors prescribe antibiotic when they are not needed, over prescribing. Patients not taking antibiotics for full length of time. Normally, what I've seen in a long-term care is the older doctors used to prescribe nitrofurantoin microbed for some patients who have chronic UTIs, and they are on like a normal medication. They take it daily, and guess what happens is when they really develop, if the body becomes resistant, and when they really need the antibiotic, they develop a UTI. The normal bacteria, like normal antibiotics, don't work. Then they go on like broad spectrum antibiotics. So that's why, like, if it's not common for the doctors to prescribe somebody microbid and you're giving them daily. Patient not taking antibiotics for length of time. So if they say that, okay, take the antibiotic for 7 days, 10 days, make sure you finish it. If you stop halfway, you're going to build resistant to it. So if you ever have an infection and your same antibiotics going to get prescribed to you, it's not going to work. My MRO poses a serious threat to clients in the healthcare facilities. 3 common types of MRO are resistant to many antibiotics. And then just remember this 3. Please write down. Can you guys see that slide? MRSA and VRE. These are most common used acronyms. Make sure you guys know that. You're gonna say, oh, the client has MRSA. Then if you don't know what it is, they will say, okay, he has a MRSA to the wound. So if you're providing personal care and that person has wound, make sure you gown and glove, use the universal standard precaution, because you can carry that MRSA, methylene resistant, into yourself or spread it to other clients. And vancomycin resistant. Okay. Extended spectrum beta Lamica ESBL is also becoming commonly associated with urinary tract wound infection. As I was mentioning, the doctors are prescribing like microbid nitrofurantoin, which is commonly used for UTI, on a daily basis, and the body builds, and then they have to switch to broad spectrum like Saptra DS or cloverline, sorry. So that's very, and then wound, they use polysporin. Polysporin is antibiotic, and you can also build a resistant. So if you ever have a wound again in your body and you apply polysporin, it's not going to work. Okay. Infection is, yeah. Infection is a disease state resulting from invasion and growth of pathogen in your body. That means the bacteria or fungus or the virus has invaded your body, and that's when you start getting sick. The first sign of infection is elevated temperature. Your body temperature rises. Body is trying to, because remember, cough, diaphoresis, sweat, increase in body temperature, pain. These are your 4 body defense it is telling you there's something wrong. So it raises the temperature to kill the virus or the bacteria that's in your body. That's the first sign. Systemic infection involves the whole way. The three possible outcomes: exposure, immune system destroys your immune system, the immunosystem destroys the pathogen. Immune system does not destroy, but the infection develops, and infection develops sometimes later after the exposure. So this means, like, your body is equipped to fight. Remember that these viruses, bacteria has been on this earth for millions of years, and so are human. Our body is designed to fight them. Antibiotic has been discovered, what, 50 years, 100 years? So your body is already designed to fight this. And worse comes when you really get sick, then you take the antibiotic. But let your body for the first 3 days, 4 days develop. Okay. Healthcare associated infection that develops in the client who cared for in any time in a healthcare given. And most of the time, like if you're in the acute, you're going to see the doctors, they come in, they put a glove on, they have the stethoscope, they go from one patient to another, and they don't even wipe that stethoscope.
Did he froze again? Yeah, I think he did.
We got cut off again, the internet.
Yeah.
Yeah. Any questions so far on infection? Sorry. Okay. Okay, let's go. Normal flow micro transmit to client from another source. Is just mostly from common urinary tract infections. Most of the time, if somebody's you doing catheter care or doing peri care and using a contaminated, didn't wash your excuse me, wash your hands properly, you can transmit the bacteria. Respiratory system infection, cold, pneumonia, bronchitis, flu. These ones, if you like, some people like you see is they sneeze and they put their hand on it and they don't wash it, they touch somebody else, they're gone. GI infection is nausea and diarrhea are the very common one. And skin wound or IV site, if you're touching the IV site with infected, they can get infected. Especially, it can all be prevented by just performing a really good hand hygiene. Isolation precautions. So if you know somebody who has an infection, Put on your gown, glove, your mask, and your face shield, and surgical asepsis. Yeah, surgical asepsis is when you're gonna be doing the sterile technique, mostly done by your nurses out there. You guys can hear me?
Yes, we can. We just can't see the screen.
Yeah, I don't know what happened.
I think you have to call him again so he can reshare it for you.
Okay. Mhm. Shit. I'll be right back. Or just one?
I'm not sure. You can take as many breaks. Well, you
I'll
can check
give
with.
I'll give them 15 minutes.
Okay, so what you lost?
And they cannot see my screen.
Share, okay. Share screen.
Oh, okay.
And then here.
Okay. Thank you. Can you see me now?
Yes.
Yes. Okay. So pandemic, you guys don't know what it means. That when there's a global problem, we just had one for the last 3 years. Normally, people become ill from a virus, develop memory cell, and recognize the latest. In pandemic, there's no memory cells for the new strain. So I will explain you what a memory cell really means. This is not part of your in there, but memory cell, like in our white blood cells, they have two. They have B cells and T cells. So the B cells are known as memory B cells. So any virus we were ever exposed to, our body, the white blood cell, builds the memory B cell. So, but the B cell, they float for years and years, and all of a sudden, you get infected with the virus. And what it will take maybe a day or two for the B memory cells to recognize which 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 white blood cells can fight this. So once the B memory cells, they find out that okay, this virus, this memory cell, and right away they start dividing. Right away, they start multiple dividing and then they destroy the virus. So those are known, and they become like, once they start dividing, it becomes T cells. So T cells are the ones that goes and kills the viruses in your body. For COVID, what happened was, because it is something new strain, our body did not have a memory cell. So they had to create, that's why we were getting those vaccine to inject those memory cells, COVID virus, the dose in our body to build that memory cell. So that's why the new strain is coming and they're asking you to take new booster shots. So that's what is B memory cells. That's what it means by in the pandemic, there were no memory cells, which is there was no memory B cells. So that's why I mentioned that our body and the virus been on this earth for millions of years. So the body has already equipped to fight this virus. Okay. Pandemic, when there is no memory cells for antigen, this is called by immune system overreacting, causing death. So sometimes, like if your body did not accept the COVID vaccine, you would be dead because there's no way your body will be able to fight the sepsis. For example, SARS. You guys aware of that the virus that came out, current COVID? Okay. You guys heard of the H1N1, which we get the normal flu shots for? It's contagious and spreads the same way as regular flu. It is not possible to catch the disease by eating pork or through the blood transfusion. The main symptoms are fever and cough. That's your normal flu season. So this one I want you guys to please memorize this one, the chain of infection, because I guarantee you it's going to be in your exams. The chain of infection, first you need a pathogen, which is a bacteria, virus, or anything. A reservoir is where they sit, and they will sit there for years, 2 years, maybe 10 years. And once what do you call, the host, which is you and me and your patients, become vulnerable, and then they release, and that's where they start getting the portal of exit, how they leave the virus. Sometimes, like, they live in a room, like in a dark area where there's no sunshine, nothing, and they will sit there for years. The way you're gonna be cleaning up, like, that you can disinfect on regular basis. And modes of transmission is how it gets moved from one place to another. Mostly it's in our hands. It will, if you don't hand hygiene, if you touch some contaminated area, you touch somebody else, and that's how it gets. The ones that are airborne, you sneeze, and it goes in the air, and that's how it travels. Droplet precaution, if not using a washroom, like for example, somebody who has C. diff uses the toilet and you don't disinfect, you go sit on there, guess what, you're gonna catch it. Right? Those are your modes of transportation, how a bacteria get transported from one place to another. Portal of entry, how it enters the host, which is your patients, how it enters. It can enter through the eyes, and any kind of body opening you have, that's how they're going to enter. Eyes, nose, mouth, ears, from anal area, right? Wherever there's an opening, if you have a cut, on your body, it can enter from there. So any kind of opening in your body, it can enter your body. And suspectable host is anybody who gets affected. Okay. So this is the chain of infection. You need a pathogen, and then it's a reservoir, how it exists in your body, how it moves from one person to another, how it enters the body, and how it affects you, the one who enters. So this is called the chain of infection. Any questions on chain of infection? You guys have any questions? It's very important to know this. Very important. I'm not going to say more than that, but you might get some blank on a piece of paper to write down what it means. So now know this chain of portal of infection. Okay. Vaccinations. We all receive vaccination. And proven to be for serious like COVID, influenza, hepatitis, TB, like all those ones we got, like meningitis. These are all the common. There's something I wanted to just came in my mind. You guys all have your 3 shots of hepatitis.
Hepatitis.
Yeah, there's 3 different shots you're gonna receive. It's really good idea if you're entering the medical field to get that done, because you'll be dealing with some patients who have hepatitis, and that will prevent you. So go talk to your family doctor, and they say, you know what, I need the vaccine for hepatitis. It's 3 different shots. You get one, and then after I think few months you take the second one, and then you take the third one, and it's good for life. It's a very good idea to have that. Otherwise, if you're dealing with somebody who has hepatitis, you can catch it, because the problem is if somebody has hepatitis, then there's no way of knowing until they get infected. So you may be taking care of a patient who has hepatitis, but you don't have they don't have any symptoms, so you will not know that
excuse me. Like I took the hepatitis shot around 8 years back, the A and
oh yeah, that
B
should be
shot.
good for life. Yeah.
But I don't have the certification for it. So do I need to take it again?
It's just for your own protection, I'm saying.
Okay.
It's not mandatory, but trust me, it will help you.
Like, do you have any booster shot for it?
There's 3 different shots.
Okay. Okay,
Yeah.
I'll talk to my family doctor then about it.
Yeah, he'll give you one, and then after 2 months, I think 90 days, you get the second, and then after 90 days, after second, you get the third one, and it's good for life. Okay.
Wait, so your family doctor gives it to you?
Yeah, the family doctor will give it to you.
Okay.
Yeah. Okay, asepsis is a practice of eliminating, reducing potential. So you are basically providing like in transmission of virus, like wiping up your sinks, wiping up your hair, washing your hands, coming out, cleaning up your shoes, not wearing the same shoes at work site, and then bringing it home, the same shoes. Always like keep one extra. I always do that. I keep one at work, and the other one I change it when I go back and forth. And then I always keep one extra pair of uniform and in your car, because you never know, you might be exposed to somebody might have puked on you, and you want to change it because you don't know what came on you. Okay. So asepsis, medical sepsis is clean technique. Well, just when you're providing, after you get your patient up, take the cavi wipe, just wipe the bedding, mattress, the rails, whatever you have touched, and wash your hands After that, medical, and then remove and destroy the pathogens. Like the new, it's two different. There's XL and KVY. XL is designed for really serious. It can also kill the COVID virus. So it's all available out there, and they will, if there's an outbreak of COVID, they will release the XL because it's very expensive. And KV wipe is not that expensive, but it kills 90% of the virus and bacteria. The best way is hand hygiene. Yeah, and keep wiping your, especially lots of, I've seen the staff, they sitting on the nesting station with the cell phones. They leave it on the counter, they come back, they put it in the pocket, and they walk away. They don't realize if the counter had it's a hospital setting, and there could be pathogens sitting on the nesting station. And guess what? That you bring in the phone, you put on your ear is opening, your pathogen is gone inside your body. Small things like that can prevent it. Surgically sterile technique, which you probably won't use it, is mostly for nurses when they're doing dressing changes and stuff, where you're doing, an incision or something that, could allow the microbes to go on. Sterile means it's free from all organism. You're going to have a sterile kit, which there's a procedure to be open. Sterilization process is of destroying of all microbes. Contamination process exposure to exposure to the pathogens. But right now, if any place you're going to walk, and if they have outbreak, there's a chemical that comes in, and they put it in the sprayer, and they spray it a couple of times a day. So it kills anything that's in the environment, in the hallway, on the door, steps. Forgot the name of that, but it's out there now. Aseptic practice breaks the chain of infection. So always keep in your mind, to prevent infection, you have to break the chain. First, try not to have a reservoir where the bacteria can sit and wait. Modes of transportation, finding a host, keep yourself, even the bacteria you get to you, your body system is strong so that it can fight. Hand hygiene is the easiest and the most common way to prevent the spread of infection. If you will use your hand, always keep a lotion in your, get one of those little Aveeno lotion, keep in your pocket, because if you're washing your hand 20 times, it tends to get dry. And my problem, I get itchy. Like I start itching myself. So I always keep that Aveeno. I always after 5-6 hand wash, I take it and just apply it on my skin to keep it moist. Practice hand hygiene, use waterless alcohol-based sanitizer, hand washing using soap and water. Because hand hygiene is the best way to prevent, to cut the chain of infection. Wearing gloves provides a protective barrier between the hand and the client's blood, body fluids, excretion, extraction, non-stick. So wear the gloves, and if you're doing somebody I'll suggest keeping your nails small, because it can tear the gloves. And you can have, if you're doing a family care with somebody who's incontinent, doing the bowel care, you can get the come inside, yeah. And always double glove if you're doing something like dealing with body fluids, changing the catheter bag, doing a pericare, double glove it, and protect yourself. That's the only thing you can do, because you have to protect yourself first before you can take care of other people. Gloves are additional protection, but not as suitable for hand hygiene. So remember that gloves gives you that extra protection, but it does not prevent the breaking of the infection chain. Always wash your hands. Gloves are additional protection. Do not wear gloves when not needed. When cautious, unnecessary wear can lead to dry, cracked skin. Replace glove if you touch So the like the protocol for in hospitals and any long-term care, like once you leave the client's room, you should throw the gloves away, perform hygiene, then come in the hallway. A dining room, unless you're feeding, you should not have your gloves on. In the hallway, you're not supposed to have the gloves on. Even though if the infection control sees you wearing a glove, they will question you. Even though you said it's clean, it doesn't matter. They want you to wash your hands. The sanitizers every 10 feet, keep sanitizing your hand. Okay. Yeah, replace gloves if you're touching anything, even the door, if you open somebody's door or touch a wheelchair, anything, just throw the gloves away. You guys, how many breaks you guys get? 1 or 2?
We just get a 1 30-minute break.
Oh, shoot. So I only gave you 15.
Oh no, it's okay.
So maybe you want to take 15 minutes now and come back at 11:45, and then we'll continue until the end.
Okay.
Okay. Okay. We don't have a. Ready? Mr. Paul. SAL. Kumar. No, I don't even know. That's it. All ready? Okay. So care of the supplies and equipment for cleaning. But by cleaning, you reduce the number of microbes present and remove visible organic matter. Disinfection process destroys all pathogens, spores, and not destroyed. and sterilization, which destroys the non-pathogen, pathogen, everything with a very high temperature. As I mentioned right now, in the hospitals, they're using ultraviolet rays. If there was a patient that was infected, they after they do the thorough cleaning, they put this light inside the room, and it disinfects the whole room. If you can find anything, even at home or somewhere, a little bit of vinegar and water works really good to disinfect. Or even the household bleach, you mix it a little bit of water in a spray can and just spray and wipe it. It kills about 50% of the pathogens. A personal protective PPE, personal protective equipment. Can anyone tell me what some of the personal protective equipment is used? Let's shoot, everybody.
Mask, gown, and hand sanitizer.
No, protective equipment.
Okay.
Best to you,
head,
right?
head covers, like hair covers and shoe covers.
No, those are not the part of the PPE. The PPE is gown.
There's a hearing protection.
Sorry?
Like a hearing protection.
No. So the PPE for glove, gown, eye protection, eye shield, mask,
Face mask.
any surgical mask. But if there's a respiratory, then you probably need N95, which you're gonna be tested for to get you the right N95. Okay, so these are your 5 protective always wear. There's a I don't know if it's discussed in there that so when you're applying on, you put the gown on, then you put your gloves on, then you put your mask on. Last, you're gonna put your eye protection or eye shield on. When removing, you remove your gloves first, and there's a way you would remove your gown, then your mask, and last thing is face shield. So these are the good doffing and gowning. Okay. So whenever you're dealing with body fluids, as I mentioned, you know that there's blood involved, if somebody threw up, or there's the diarrhea, or you emptying the catheter bag, always wear PPE. Isolation can transmit, sometimes isolation precaution are guidelines to prevent the spread. So you probably will woke up and then to a facility and they said, oh, so-and-so is on isolation. That means there's some contagious virus or bacteria they are carrying. They have to continue staying in the room. There'll be signage out there, and the facility will place the supplies outside the room. So you dress yourself before entering the room. You go do your care, whatever. You remove it inside the room. There will be a contamination bucket where you're gonna throw all those gloves, gowns, and stuff, and then you're gonna perform a hand hygiene inside the room. Come outside, perform your hand hygiene again. There's 2 types. There's a standard routine practice, standard precaution, and there's transmission-based protection. So as I mentioned, remember that some people might be on reverse isolation, or they're gonna like if they have something major, they probably be sent to a contamination chamber. There's some they have it in the hospitals. If something serious, which the doctors or the lab techs are not able to determine what kind of virus is it, they are sent to a different, they call it isolation chamber. and they're mostly in the acute hospital. So standard practice, all times in all settings. Just the standard practice is like, you don't have to put on a gown. You wear your nursing scrubs, put in your gloves, and go inside, do your care, come out. Those are like standard precautions. You're gonna be washing your hands, then put a little bit of sanitizer, and then sanitize your hand. Are used all person whenever care is provided. Prevent the spread of infection, like if you're dealing with body fluids, all fluid, secretion and non-secretion, and even sweat, even if blood is not visible. People can excrete virus through the sweat, which is also known as, medical term for sweat is diaphoresis. So if you had, somebody's having diaphoresis, they know that it is sweating. Non-tech skin can open and break very easy, especially elderly. The skin is like paper, little touch and it can break. And mucous membrane, including nose, eyes, vagina, and rectum. So that's where you can get some really serious viruses exiting your body. So there's three types of transmission, as I mentioned earlier. Airborne, which carries by the air, like you sneeze and it goes. Influenza, for example, tuberculosis, H1N1, they get transmitted when you sneeze. And droplet is like a C. diff, where you droplet precaution, where you're going to drop like a little bit of body fluid, and the bacteria is going to start dividing. COVID, they say it's droplet, but they have not 100%. That's what we do, is we use the droplet precaution and contact precaution. If by touching a contaminated person and touching another person who's clean, or transporting on yourself. Follow the guidelines of contact pathogens. You will be told when the transmission-based practice is ordered for the client. So most of the time, the order comes from the CDC, which stands for Canadian Disease Control. And they are based here in Vancouver on West 6th, Center of Disease Control. So they will, the director will call them and let them know that this is, and then they will send the samples to the lab, and the lab will determine, okay, this person, so they right away that person is put on isolation. But when we normally now, because of this deadly COVID, anybody showing any symptoms, they are placed right away on isolation, because we don't want to spread it until the result come back and that person is positive. We only keep there negative, then we can bring him out. But if you notice anybody with symptoms, report it right away. Runny nose, sweaty, increased body temperature, cough, pain, lethargic. So just this thing needs to be reported right away to your charge nurse. So yeah, client is normally placed in the private. If they are in the shared room, they will try to find a private room. If not, then they don't have any choice to keep them there. Yeah, some of the places, that's why the COVID was spreading like crazy, because a couple units I went, there were like 4 beds in one room. And guess what? If one has a COVID, it's rest gonna get, because there's no way of to keep isolating them. Isolation precaution, always use your protective PPE. Indicates glove, gown, eyewear, and protections. Removing linen, garbage, and equipment from the room require double bagging. So most of the time, if you're in a long-term care, they have a red bag which means that it has contaminated linen in there. And then that bag doesn't get opened. They throw the whole thing in the washer, and there's a special chemical that melts the red bag, plastic bag, and washes the linen. So they come with this special bag, which is, and also if you're dealing with somebody who is on cytotoxic, like cancer medication, like there's some breast cancer medication, some prostate for men, they are on tamoxifene or tustricate, there will be a sign posted for you guys to know that it's a cytotoxic. And from my, as you guys, I have two female here. If you guys are pregnant or planning to get pregnant, you should let your nurse director know that to change your assignment, because you don't want to deal with them. If you might, there's a possibility that your baby or child can be born with this abnormalities, because this alters the DNA. Okay. I'm not supposed to tell you, but I did tell you. So following agency procedure, collecting the specimen, transporting every facility, they'll give you, like if they want you to collect the stool sample or urine sample, the nurse will give it to you, and they are pretty simple. They will tell you well, like stool sample, like there's two types of tests. One is the CNS, and the other one is occult blood. And most of the time, the nurses do collect the occult blood test, but they will ask you to collect the urine, especially if they're going for a urinalysis or urine CNS. Okay. For the isolation precautions, wearing mask and respiratory protection. Masks are worn for the following reasons: to protect from contact with infection agents and the client to the resident. So as I mentioned, it's sometimes from the client to or resident to yourself, or from yourself to client who are on reverse isolation, and you'll know that. Tuberculosis respiratory are worn when caring for clients with TB. N95 respirator airborne isolation precaution. N95, you will be fit tested when you start any kind of healthcare. They will fit test you, and they will give you a number, and that number you keep it for yourself for 2 years. And after 2 years, they're going to do that test again. They'll give you a whole bunch of marks, and then there's about 5 different, one that's appropriate for your face that fits. So keep that number always with you. And if there's any kind of respiratory major outbreak, when the N95 gets released, they will ask you for those numbers. Okay. And then because the reason why they don't release N95, because one N95 mask is about $60. And it's one-time use if you're using with tuberculosis. So that's why they didn't release the N95 until there's a really need for it. Your responsibility is to be fitted. Oh yeah, it's already here. Fitted for the correct type of mask to wear, it properly following the employee policy. So you will get the notification. Okay, we're doing the N95 test. So they will tell you, like there'll be some staff who are trained to do the test. Okay. So wearing gloves whenever contact with bodily fluid, as I mentioned, anything, but in any kind of situation, if you're dealing with care or feeding somebody where you're going to be exposed to mucus, when you're feeding somebody that can sneeze on you, always have a backup plan. And my suggestion, always keep spare clothes, your spare nursing scrub with you all the time. Gowns and other protective clothing, which will be supplied by your supplier, I mean, the health authority you're going to be working with. And yeah, you can double gown it if you think that you're going to be exposed from the back, because the back is open when you gown it. You can put another gown from, nobody will stop you from doing it because you're protecting yourself. And as I mentioned, if you're dealing with body fluid, double glove, because you have that extra protection. Some cover your knee up to the knee, like, see, you've probably seen the yellow gowns, the blue gowns, they are available. They can only be used once. A wet gown is contaminated. Disposable gowns are discarded after use. So it's single use only. So wearing your eye protection and face shield, goggles, face shield, protect eyes. And now they have this mask, which already has a little eye protection on top. It has a little shield. You can use that. But it's a really good idea if you're dealing with COVID patients to have a really nice eye protection. You can pick up from Home Depot or somewhere and always keep it with you. Because the ones they provide at the facility are horrible. It's going to hurt your eye. So just keep one really nice light one, that spend that $20, but it's going to be good for you for safety glass. Reusable eyewear can be like, they'll give you a face goggle, face shield, and then that can be reused. You just wipe it with KV wipe, Excel wipe, and then you can reuse it. But now they have the disposable ones as well, where you use it one time and just throw it. You may come across needles that are improperly disposed of. This is especially common in a home care setting. Like sometimes if you're in the home health, the client takes insulin and they just leave it on the table. They don't properly dispose it. Just be extra careful, because that person might have AIDS. And if you get pinched on that, you're in serious trouble. Because one of the home health nurses got stabbed by a needle that was left behind by a client who was diabetic, but later on they found out that he was HIV positive. Because now with the freedom of right, they don't have to let the caregivers know that they are HIV positive. So it's your way to protect yourself. And now we're currently fighting, the union is fighting for that, that we should be made aware if somebody has AIDS or something that can be deadly for the staff. So right now they are in court battling it. Hopefully by the time you guys graduate, it is legal for them to let us know. Okay. Sharps container must be tightly kept, puncture resistant, leak proof. So whatever goes in the sharps container, you cannot take it out. And once it's sealed, you cannot open that. So make sure you don't close the lid if it's like 1/3 full, because once the lid is closed, you cannot open it anymore. They are designed that way. You guys have any questions so far for me? Nima? Okay, bagging items. As I mentioned, contaminated items are bagged and removed from the patient's room, and they're special right now, red bag with a biohazard sign on it. They will give it to you, and you just, once you pack it, if seal it doesn't get opened. So it goes in a special incinerator, and if it's body linen and clothes and stuff, they go in a washer without the bags being opened. Leak proof bags have the biohazard symbol on it. You probably at the facility or anywhere, if somebody is on cytotoxic precaution, there will be a spill kit available for that. And if you have somebody like who is on cytotoxic, and if they urinate on the floor, that has to be cleaned up differently. Okay. And trash placed in a container labeled biohazard, even the garbage companies, they pick up, it has to go to picked up by the Stericycle, and they are taken in Alberta somewhere and thrown in the incinerator. They get never opened. So there's a sign of biohazard. If you see this sign, you better be 5 times careful. It looks like an alien, but it is an alien. So anything that contains that sign, never reopen the bag. Always grab a new one, but never reopen the bag that has already been sealed, because you don't know what is in there. Could be blood. It could be, somebody who is cancerous. There could be the urine bag was changed. Especially male with prostate cancer, they have catheter bags. And it also, they are on cytotoxic medications for prostate. And those ones, you don't want to deal with it. Okay. Transport double bagging is not needed unless the bag is soiled or contained. They are good. You let the people who do the housekeeping, who collect the garbage, they know they pick up all the good garbage, and then last they come up for biohazard garbage, and that goes in a special container which is sealed and transported. Isolation transporting biohazard waste. Double bagging is okay. I've done that one. And I have the license to transport the biohazard too. During COVID, that was my sideline business I used to do. And yeah, so you have to take a special training for 2 days in order to, because I used to do COVID sampling for the movie sets. So I met lots of movie stars. Yeah, so movie sets, and I used to contract out through a company, and I was making good money. Yeah. So isolation precaution, clients on transmission base, clients do not typically leave their rooms if they are on isolation. If they have dementia and they are wanderers, most likely the facility will arrange extra staff to come in and try to keep them, guide them, to keep them in the room. Proceed among the employees. The safe transportation means that other persons protected from infection. Follow employers' guidelines. So if there's your outbreak, they will have a huddle. Your director, your manager will, and the clinical nurse will have a huddle. They'll let you know what it is and what to observe, what to expect, and that's it. So transmission-based practice, meeting basic needs. Often love belongings to personal esteem, need unmet transmission. The person feel lonely, unwanted, and rejected. You need to you get your what do you call your holistic approach at that time. So surgical asepsis is, you probably will not be dealing with this. It means if somebody providing like any kind of catheterization or intubation, wound care, these are mostly done by the nurses. So it's just for you to know what a surgical asepsis is. Okay. Any questions, guys? I'm on the last slide. So principle of the main reason for sepsis infection control is to prevent the spread of pathogens that cause harm to the people. Okay. So all items in the contact of the clients are kept sterile. The sterile field is needed. You need to sterile glove when assisting with the sterile procedure. You might be asked by your nurse, like if they're doing a wound care, for you to assist them, like passing them. So you need a sterile technique, a sterile glove, which is pre-packed. And there's a special procedure of applying and removing them. So if I get to the field, then I can teach you how to do that as well, just for your knowledge. Any questions, guys?
No.
No.
Okay, so we almost we're done chapter 19. You guys wanna, if you have access to your infection control book, that's, you can we can discuss this all different types of so we don't need the slide. I'm looking at the book and I'll go like different types of airborne and the airborne and then like COVID-19, all these different types of infection. Chicken pox, we all had that, right? Chicken pox. So that is airborne. Chicken pox is airborne. When later on in the life, like if you get the chicken pox vaccine, later on down the, when you get, people get older, they develop a condition. You guys, anyone can tell me what condition they can develop? It's skin related. Have you ever heard the word shingles? Okay, shingles is it's a very painful infection. You're gonna get, mostly it's gonna be on your abdominal, lower abdominal area, thigh. It's very painful. It's the same virus that causes chickenpox, and those kind of has to be put in isolation. And you have to use the universal precaution when you go into taking care of them. They have to be put on isolation because it's very contagious as well. So until the lesions are present, they'll be red, and lesions, once it starts drying, then they are safe. But if it's flamed red, they have to be isolated, and it's very, very, very painful. Any questions on that? Then the second one is C. diff, as I mentioned, is direct contact. Severe diarrhea, abdominal cramps, and it's very contagious. So if you're dealing with a patient who is has C. diff, be 5 times more careful. COVID-19, we all know there's been and then there's respiratory illness like bronchitis, emphysema, tuberculosis. These are all respiratory related. Measles is another one, which is airborne. We were lucky that last year we had some measles cases here in Park East, but we didn't get it up here in the BC. We were very lucky. And that came from, I don't know, that came from with the pay. It was very severe. I don't know, I forgot the name. It was some country named measles. Measles are similar to chickenpox. They're in the same scenario where have you seen somebody with measles? No. Have you seen someone with chickenpox?
Yeah.
Yeah. So just
Myself.
imagine chickenpox are small, measles are 5 times that size.
Is it like big bubbly thing on your body?
Yes.
Okay.
If you've seen chickenpox on you, like everybody almost gets it. And it's like the lesions, the purpura, the one that comes out is about 5-10 times bigger than. It's very, very contagious and very, very dangerous. Rubella, we already got those vaccine when we were little kids. As I mentioned, hepatitis A, B, and C. Please, if you haven't got it, go get it. Especially you're entering the healthcare system, you're going to encounter lots of people with hepatitis, especially chronic alcohol users, people who drink a lot, they end up developing hepatitis B, fatty liver, and you won't know until they get diagnosed, and yet you're dealing with it, and your body is totally exposed to it because it's becoming very common. HIV, so I guess I mentioned, they don't have to tell us, but hopefully the union can win, and they have to let us know, especially as caregivers, that this person has AIDS or HIV. Then we can protect ourselves.
Like, can we also deny, like, if we don't want to work with a HIV positive person, or it's like with a person with a serious illness, can we deny it that we won't be doing
It
work with
depends,
critical
like
patients?
depends if we have some kind of yes, if it's unsafe, because it's not contagious, because to get a HIV you have to have their body fluid come inside your body fluid, but you're providing care, there's no exchange because it's not airborne.
Yep.
So you can, but if this person has like lots of cuts and they are bleeding and then you have to take care of them, yes, you can you have a right to refuse unsafe work environment. But but you cannot, like, they will ask you, like, why are you refusing? Just because this person have it, that's discrimination.
Yep.
You're discriminating that person because they are HIV positive to provide care. But if your safety is not good, if say this person is alcohol, you walk you're in the home support, you walk in the house and the person has HIV and he's drinking, and he has a needle, like he's going to inject himself, he's diabetic. Yes, you can refuse because he's intoxicated. You don't know if he injects himself, you can get injected as well. If it's like that, refuse and walk away. You won't get into trouble. And then HPV, human papillomavirus virus. This ladies probably you guys have to go for this test. So it's very, very. You can have that. You guys got it in your high school, because they're normally they give it to girls at grade 10 or 11. Once they start getting their menstruation cycle, they get this HPV vaccine.
It was like grade 6 and grade 12.
Is it? Yeah, I'm not sure, but here I think in Canada, my daughter got it when she was in grade 10, I believe. But I don't know if they get it in grade 5. Do they do it? Nima probably knows more than. Do they do it at grade 5 in Canada too?
I remember grade 5, no, grade 6 and grade 10. There's only
something
2.
like. Oh, okay.
Yeah.
So I mean, if you're over 40, I don't know how young you guys are, but make sure you get it done. Your test every 24 hours. 24 hours every 24 months. It's very common right now for cervical cancer. It's coming pretty lots of females are now diagnosed with cervical cancer, and by the time they detect, it's already metastasized to your ovaries and then to your kidneys. And I've seen younger and younger people are in the end of life care in hospice because of this. Okay. So MRSA, can everybody tell me what it stands for?
Please repeat.
MRSA. Remember I said VRE, MRSA, MAO, MAR.
MRC stands for methylene resistant.
Yes. You look in for Google, huh?
Yeah,
It's a methicillin resistant Staphylococcus aureus. Staphylococcus aureus is a type of bacteria, and methicillin is antibiotic. So And then VRE, vancomycin resistant. That's about it. So let's review the whole infection control. What is a chain of infection?
Oh,
The first slide. Chain of
transmission.
Reservoir.
this one. I need you to guys to, if you have a paper, write this down and draw it. Because I know that sometimes in the quiz and your exam, they will give you this thing and then you have to write down what it is. This is called, yeah. Okay, so let's review the some of the questions from ET. Still, you have about an hour. Okay. Okay, let's do you guys have access to your chapter and review questions. Let's do it together as a group. It's on 374. You guys have access to those? No? Let's review it together. Okay, the first question. Mr. Lee has alphagia, alopecia. This is A, excessive body hair, dry white flake scalp, and investigation of lice hair loss. Alphagia,
What does he have?
alphagia, alopecia, alopecia.
Oh, it's hair loss.
Yeah, good. Okay, when brushing hair that is not mated or tangled, start at the forehead, brush forward, where the hair ends, the scalp, and brush towards the hair tips and the back of the neck and brush forward. Which way you brush your long hair? You start from the top or you start from the end?
On the top.
If it's tangled, you start it from the end, so you can untangle but if it's not tangled, you can start it from the top.
No, yeah, it's tangled, so you start at the bottom.
Yeah, from the bottom.
I wouldn't know that because I never brushed my hair for the last 20 years. So. Okay. Mr. Lee wants his hair washed. You should wash his hair during his shower, wash his hair at the sink, shampoo him in bed, and follow the care plan.
Wash his hair in the shower.
Awesome. Yeah, Nima, you already passed now. You answered two out of three questions. Good. Okay. When shaving Mr. Lee with a blade razor, you need to do the following. Remove an existing beard and mustache. Moisten the beard before shaving it. Shave perpendicular and direction of the growth. Shave when the skin is dry. I mentioned this. If you're going to shave somebody with the blade.
Wait, can you repeat the options again?
Maybe the third option.
Shampoo him in, no, sorry, no, wrong one. Shave perpendicular to the direction of the hair. That means the hair grows down, you shave upwards.
Yeah.
Moisten the beard before shaving.
Wash
Moisten
the
the beard before shaving.
Yeah.
Good. Because I remember I mentioned the best thing to soften is you wash it with shampoo. It makes it really soft and easy to shave. That's a secret. Or most of them have shaving creams. Good job, guys. Oh, Mr. Lee is famous now. Mr. Lee is nipped during the shaving. You should first, the first action is to practice proper hand hygiene, apply direct pressure, tell your supervisor, apply bandage. If somebody has a cut and it's bleeding, what is the first aid?
You tell your supervisor.
Huh?
Well, you need to
Tell your
find
supervisor.
if
And
wait,
your supervisor is end of the hallway. You're gonna leave him
who's
bleeding?
bleeding? You're bleeding or your patient's bleeding?
My patient's bleeding.
Oh, then you find the first aid kit.
First need to wash my hands.
Yeah, obviously.
Personal hygiene first.
Put
No,
the
I
razor
mean,
away.
the options are practice proper hand hygiene, apply direct pressure, tell your supervisor, apply bandage. So when somebody is bleeding, what do you
Oh,
do?
you don't apply
Apply
bandage.
pressure.
Apply pressure to control the bleeding.
Oh.
And then you can apply a bandage, let your supervisor know they can apply a bandage, assess and apply a bandage.
And put the razor away.
Yeah. So that's why it's very important. Just ask them to use an electric shaver. I'm not comfortable using a razor. I have like over 20 years of experience, but I'm still not comfortable using razor to shave someone. I'd rather have an electric one. I don't have no issues, but razor, I don't know. I can't. Maybe I'm just getting old, that's why. Okay, when shaving a man's face, you should shave left to right from one side to another, right to left, one side to another, up and down from the chin and neck, down to up from the neck and chin.
Does that really depends when you shave a person? Like if you do it up and down or the other way around?
Because because remember which way the
It's
hair
just-
goes. When you're
Yeah,
shaving, you go against it, right?
Yeah.
But if you're using an electric razor, it doesn't matter that much.
No, this is talking about the manual.
Oh, manual.
Yeah. So you go from bottom of the neck up. Yeah. So answer is D, down to the neck to the chin. So you go against the grain of the hair. How you guys shave your legs? Do you shave from top to the bottom or bottom to top?
I don't shave my legs.
You don't shave your leg, I know.
I think we go like
Start from the bottom and you go all the way up.
Yeah, so you're going against the grain of the hair. The same way when you're shaving somebody, you go against the. You should start, Amritpal.
What's that? Shaving my legs? No, I used to shave my beard and with an electric razor.
Okay. Should never attempt to trim nail on clients who are, I already mentioned this. If someone is You don't
They
do
will
that.
just,
No, nails.
oh, nails.
Yeah, you should not do, let the podiatrist do it, who is diabetic.
Diabetic.
Yeah, diabetic patients, let them, the podiatrist, the doctor who's specialized to do it. They don't cut, they grind it. They grind the nail. Anti-embolic stockings are used to dead stocking, remember, compressing stocking, also known as edema wear, are used to
Blood circulation, improve blood circulation.
That
increase the, yeah, increase the, like, blood circulation, but what else? Why they call edema wear? They're also known as edema wear because your feet is swollen. So the main reason is to take the swelling down. And if somebody has a swollen feet, what is the condition that is the patient experiencing? CHF,
Diabetic.
congestive heart failure.
Congestive heart failure.
Yeah. So if you know that somebody's feet are swelling up, you know that's the sign of congestive heart failure. Okay. Anti-embolic stockings are applied before the client gets out of bed, when the client is standing, after the client showers or the tub bath, after the client goes to sleep.
After the shower.
our
Before the client gets out of bed.
Oh.
Yeah. Then it's you can, because after shower, like you won't be able to apply. It has to be on a supine position in order for you to easily do it. As I mentioned, that it is very, very difficult to put that. Like one client I did not too long ago, he was paraplegic. I started to sweat. That's how tough it was. He had he was doing mountain biking, and he broke his spine. He hit his head on the tree, and then he's from waist down is paralyzed. But we do put the stocking, or it gave me a sweat. I started to sweat after I put it, and I was huffing and puffing. So some of them are very, very tight. Okay. When applying a elastic bandage, the body needs to be in a good alignment. The finger and the toes are covered. Applied from the largest to the smallest and applied. So you're not going to be doing this, so I won't even bother. But it's good to know. The body needs to be in a good alignment is the answer. But yeah, if you ever get asked to do that, just say no. You don't want to do it. Because if you put it too tight, you can kill that area. When dressing a client who has hemiplegia means half. Mostly people with stroke, one side is all. Like quadriplegic, that all four limbs are not working. Hemi is one side, it could be left or right. Para is half body from the waist up. Quadriplegic, paraplegic, hemiplegic. Hema means half of your body is dead. Para is half of your body in horizontal, like lower limb, and then paraplegic, all four limbs. Mostly it happens, paraplegic happens with the spinal cord injury. Hemiplegic happens with stroke. People have a TIA, stroke. And then paraplegic is also linked to spinal cord injury. Depends where the injury is. Okay. Okay. So if you're dressing somebody up, which one you're gonna put on first, the good side or the weak side?
Good side.
Weak side?
Good side.
Hemiplegic and on the right side, right? So yes, you're gonna put it hemiplegic on the right side. You should place the client's right arm inside the sleeve first, the weak side.
Oh,
When undressing, you do the good side, then undress the weak side. But when you're dressing, dress the weak side, then put it on the strong side. Sounds a little bit, but in the real world, you're gonna dress whatever is appropriate to make your work easy. But for your exam purpose, undressing, good side first, weak side second. When
Yes.
dressing, weak side first, good side. Because in the real world, the things don't happen by the book.
Yes.
Okay, so true and false. You can shave a client's beard, and most if you think he would be more comfortable without facial hair.
False.
False, because we have to ask the patient first.
Good, good. Okay, true or false? When dressing a client, you should dress the unaffected side first. We just discussed. Dressing.
No,
Dressing.
Yeah.
True.
no, no.
No, false.
False.
You dress the unaffected.
Yes.
Any false?
Oh.
Yeah, you don't dress the unaffected side. You dress the affected side first.
Mm.
If you have a left side paraplegia, you're gonna be dressing when you undressing. You're gonna do the good side. When you're dressing, you do the bad side. Opposite. Clothing is removed from the unaffected side first.
False.
False. There's somebody's listening to me good now, Nima.
I was listening the whole time, but I just wanted to give them a chance to answer.
Ah, oh, okay.
I said, yeah, I was listening. Yeah.
Yeah. Yeah. So remember that when you're undressing, good side, bad side, dressing, opposite. A client chooses what to wear.
True.
Yes.
True.
Wigs should never be washed. They should be only be dry clean.
What shouldn't be washed?
Weak.
Wigs, your fake hair.
Oh, wigs. Of
Yeah.
course, they should be
Yeah.
washed.
True.
Okay, that's good. Any questions on that first chapter?
No.
Yeah, your name Pema, right? Pema, that's how you say your name. You should come
Yeah.
by and grab your book text. It's really, there's lots of information here.
Yeah,
need.
I will.
Yeah. It's good to pre-read, and then when you following along with the lecture, then you understand better. Always pre-read the next day's lecture. It helps a lot. Okay, let's do. If you guys have the lab, whoever is here, we'll teach you how to do proper hand wash, doffing and goning, doffing. Okay, so let's do some true and false on the infection control. Okay. A pathogen can cause an infection. True or false?
Oh. Oh.
Pathogen.
False.
Pathogen can, what is a pathogen? It's a bacteria, fungus, or virus.
Bacteria.
Virus. Bacteria.
True. Because pathogens are microbes. Okay. Second one, MRO. I'm going to use the acronym now. So maybe hopefully you guys know MRO are easily treated with antibiotic, and because that are not a risk in a facility. Well, this MRO, multi-drug resistant organisms. Organisms are not easily treated.
True.
It is treatable, but you need a special antibiotic. There's a broad spectrum of antibiotic. It's known as Tomacol and Fluvin. They are the one that it's the what the broad spectrum is, a combination of two different antibiotics. So they mix the two antibiotics and they treat that. It's treatable, yes. Older person often do not show usual signs of infection. Older people, somebody just think like somebody who has dementia, how they react if they have pain. They know they have pain, but how they are not able to elaborate the pain.
Twitch. And
They
like
will twitch,
body,
change in behavior.
yeah.
The most common thing is change in behavior. If you have any of your patient, all of a sudden, the behavior changes, you know there's something wrong. Especially with dementia and older adults, there's change in the normal habit, behavior, they're sleeping longer, they get aggressive, they get agitated really fast, you know there's something, some sort of infection. That's the first sign. And that's true, they don't normally show the proper, like some signs, the proper signs of it. Okay. They do not show the usual signs of infection. Most of the time it's the behavior changes. So this is pretty well. The presence of illness and use of an invasive device increase the risk of infection. You know, an invasive device that goes inside your body. Like otoscope, you're looking inside the ear. You know, you look at, you get the tongue depressor and use the flashlight to look on the ovuli. Catheter, these are invasive. That something that goes inside your body. And some of the female will have vaginal prolapse. You guys heard about that? You know about the, and then you look, when you're doing the personal care, it looks like there's an egg in the vagina, but it is not. Yeah, one time one carer go, oh my God, this lady have an egg stuck up on her vagina. And I went and looked, it was a vaginal prolapse. So it's a device, it's like a normal, and then the bottom is oval. So what they do is the female who have problems like the uterus dropping all the time, coming in the wrong side. So they put this, and then once this is inserted, they twist the bottom with this tool, and it opens like an umbrella. So basically it sits there and holds the uterus up. So you're gonna
uterus up. Does it hold the uterus up, you said?
Yeah, it holds the uterus up.
Okay.
Yeah, you'll see that it's pretty common in females in the long-term care, and you'll think there's like a normal egg hanging, like you'll see that white part. But if the doctors, they need to remove it, they have a special Allen key. They put it in and they twist it back, and then it closes and they pull it out. It's similar way they use the IUD. You guys have experience with IUD, the birth control? So it's a similar procedure like that. It gets inserted and then it opens up. So those are like all are invasive. Okay. You should always wash your hands before and after giving care.
True.
True.
You should hold your hands and forearm up during the hand wash procedure? Are you going to be holding like this?
No.
Because you're dripping all the dirty on your arms. So you hold it down so that the water drips. Can you guys see me?
Yes.
Oh,
Yes.
because I can see myself. The duration of the hand wash is very important. It's not important. True or false? If I
The
mention
duration of?
happy birthday, you should wash your hands until you finish singing happy birthday.
True.
True.
Oh, yeah. You have to, like when you're washing, you're going to first moisture it. You put the soap, you're going to rub, you're going to go between, you're going to take your thumb, you're going to wash the back, and then you're going to take your fingernails in here, then you're going to clean, and then wash it, take the towel, dry your hands, and then close the tap with the towel in your hand. You don't retouch the towel, sink. So take your, the paper towel, wipe your hand, and use that to turn the water off. Disinfecting usually involves chemicals.
False.
That's a technical question. Let's see who comes right.
False.
What you? What do you think, Penny?
False, because we need high temperature.
Exactly. You can kill it with temperature. You don't necessarily all the time have to. As I mentioned in the hospitals now, they have it looks like a big tower. They put in the room and blue light comes out and then it disinfects. They leave it there for 5 minutes. And they think that ultraviolet ray kills more than chemicals. Good, guys. Usual item in the client's room can be used for another client.
False.
Yeah, false. You don't interchange the clothes for one client. That's the big infection control. Because one client might have some condition and you're transporting it to the other one. Right? So never use any clothing for anybody. If you're gonna use it, say sometimes there's people that's gonna come in the long-term care who cannot afford good clothing. And then you have a lady who is a millionaire died, passed away, and she has really nice clothes. Before you're gonna give it to there, make sure it goes to the laundry and get washed really good. And then you can reuse it. Isolation precaution includes standard practice, transmission-based practice. True? Isolation. Why you need to isolate somebody? Because they have infection. Some way they're gonna transmit the infection. You're gonna do two types, right? Standard precaution and transmission based. So that's true. Transmission is based is like somebody has a C. diff, TB, or any kind of like respiratory, like influenza, H1N1, SARS. And isolation precaution is like somebody experiencing any symptoms like COVID or coughing. You're gonna isolate them because you don't know what they are carrying. So they're gonna spread it to other people. So yes, isolation precaution is for both transmission and standard. Standard precaution used only when the client has a specific contagious disease.
False.
Yeah. If you see any symptoms, anyone, isolate them until you know that this is not contagious or the symptoms get better. Good. Transmission-based practice are guidelines to help keep pathogens within one area, usually client's room. Why do we isolate the clients? To keep the pathogen in the room and prevent from spreading. So that's why. Okay. So that's true for that. Okay. Goggles, masks, gowns are worn when there is a risk for splashing blood and bodily fluids. True, false?
True.
Good. Yeah. Even if you just your patient doesn't have any contagious disease, but if he's going to do a catheter bag change or changing the catheter bag, and you have a risk of when you're removing the urinary tube, it's going to splash on you, gown up, because you don't know what they have in the, what kind of infection they have. The reason why you use the PPE is to protect yourself. And always keep in your mind that you have to protect yourself first. That's your first priority, because you want to come back to your family healthy. You do not need to report sharp injury if the bleeding is not severe. True or false?
False.
False.
Awesome. Yeah. Maybe you had a nail stick injury, and your patient had hepatitis or HIV. You need to go to the emerge and get it tested right away. An item is sterile and non-pathogenic are present. An item is sterile, like you have your linen, clean linen sitting in the hallway. Are they sterile? Remember, there's two types of clean and sterile. They are clean, but they are not sterile. Okay. The 2.5, oh, you don't need to know this. When we open the sterile kit, you've seen that, it has all the sterile equipments or wound care when you do. The 2.5 centimeter around the edges of the cloth is considered contaminated. From the edge, you open. There's a procedure to be open, but you guys don't need to, it's not in your scope. Open, but 2.5 around the edges is considered contaminated. How was the review so far? Can I repeat one question and see if you guys still remember the answer? Unused item in client's room can be used for another client.
No.
Okay, that's good. It's 1 o'clock. What do you guys want to review your slides if you want to go over and then
The class end at 1 o'clock?
huh?
Doesn't the class end at 1 p.m.?
1 p.m. or 1:30? He said 8:30 to 1:30. Let me double check. I think he told me 1:30, but let me double check.
Okay.
Yeah, 1:30.
Okay.
8:30 to 1:30. Before it used to be 8 to 1. When we first started teaching here, we start the class at 7 and finish at 1. And then the second class used to start at 5 until 10 p.m. So those are the ones that work during the day. They would come. Okay, so anything else you guys want me to go over? You can ask me any general questions. I'm open for it. If you want to know how the field work is, like what is needed there, like, because I can answer you right now. Any questions, like, you want to know, like, how is it to work as a RCA in the hospital or long-term care, home health, home support, or deployment, you can ask me. So what the way you plans are to get hired, Rima? Where you want to work, long-term care, home health, hospital?
I think home care.
Home care. Okay, that's good. Yeah, it's good if you're in the home support, home care, you get a cluster. It's nice. The cluster is like you go in one assisted living and do like 5-6 clients. You stay there for 8 hours. But then if you go home support, then you get like depends. If you get a 1 hour for client, then you have 15 minutes drive time, because they will set up your route. There is about 15 minutes drive from each other.
Which one would you suggest, sir, for us?
Depends what you like. You like
How
like
about hospitals?
I worked first. I started in long-term care. I also worked in the hospital, acute. Between acute and long-term, I would prefer long-term SNS for me, because long-term is easier work for me. Now I'm with the regional deployment, and I like that because I'm not in one place. I get to travel. At my area is all the way from Burnaby to Boston Bar. So I'll be traveling anywhere in between, but I'm not in one place. Like in a long-term care, like if there's an outbreak or something, you're doing the same thing over and over and over. But for you guys, like, to start, I would say, home support is easier work than a long-term for the RCAs. Because home support, the client is not that heavy. If you're working in the long term, your ratio is 1:8, 7 to 8 clients, patients. And it gets heavy. Depends what you like to do, right?
Which one pays more?
They all
Which
pay
one
the same.
pays more?
All pay the same, 28.62. That's the new contract that ATU got for you guys.
And where do you get more hours of working?
Long term. Long term care, you get lots of overtime. Yeah, lots of overtime in long term care, because there's always people calling in sick. And if you're a frequent flyer, you always, that we call them, whoever takes a shift, the schedulers don't want to waste their time. They just call that person, you want a shift, take it. Yeah, I do lots of overtime. I just did, with the regional deployment, I did almost 22 hours overtime already.
But you have a 10-hour shift or like 12
8
hour
hours.
shift?
8 hour shift.
Okay. On the overtime?
Overtime, 8 hours. We all run the 8 hours. Sometimes I do overtime like double shift. If I'm working 7 to 3, that's my permanent line, 7 to 3. And then somebody calls in sick with the same client, or then they'll call me. You want to stay until 11? Why not? Because I'm already there. Sometimes I do overnight and then work 7 to 3, my regular. So most of the time we do patients who are they come home after surgery, or they are waiting to be placed in the long term. So we go as a nurse, we do the assessment, we make the care plan, and the RCAs also go there and they just follow the care plan. Right now They need 60 RCAs and 10 LPNs. They're going to hire next couple of weeks. So keep me in mind, and once you guys graduate, I'll definitely can get you guys in the deployment. It's pretty nice.
Yeah. So like, sir, are we gonna have theory class and practical class for throughout 6 months?
You guys?
Are we gonna have theory class and in lab class for the 6 months, or like do you send us for like in field?
No, I think these guys, they're gonna send you to a long-term care with instructor.
Oh, after
Or
3 months or after 6 months?
after
No,
2 months.
it's gonna be varied. Like you finish one semester, you go, and then you do come back second, and then you go again, and then last you do your preceptor, like But I'm gonna find out because the program has changed. But I'm really before that's what they used to do.
Oh,
You class for certain, and then you go out in the field for 3 weeks, 4 weeks, and come back in the classroom, and then go again, and then you come
No,
back.
we like they told me to like you would be in the class for 2 months and then you would be going for work for 270 hours.
Yeah.
With an instructor in a
So
long
you
term.
guys under the Okay, that's good. Yeah, you guys under the HK program.
Yeah, because I have to tell my employer once the practical starts because I
you
work on
guys
a
are.
15-day rotation.
You know that if you go and work, you're gonna get paid same rate as a carried.
Okay.
Under the HCAP program. I don't know if you guys are under HCAP. Your school is paid by the government, right?
School is paid by the government?
no,
You guys okay. You're not under HCAP then.
no.
There's a program by the health authorities known as HCAP, where they get a person with no experience, they hire them, and they pay for the school. And then when you out there working, you get paid to be out there. And while you're in school, they pay for the tuition, plus you get 3,900 a month for your personal expenses while you're in school. So that's the new HCAP program. Yeah, I think you guys should look into that.
Yeah,
No, like if you apply for that aid, the government pays you a lump sum.
Yeah,
Like you
go on
can.
the Fraser. I know Fraser Health. We just have quite a bit of HCAP students. Go on the Fraser Health website, and it called HCAP program, and look into that, because they will pay for the school. They will pay you while you're in school. Also, when you go out to get your training, you're gonna get the same rate as RCA.
I need to talk to Deshan. He's already taken money from me.
No, I
yeah,
don't
same
say.
here.
I cannot tell you the guys this.
Because like
You didn't hear from me.
yeah, because like I have one friend. She like she went for the interview and she like she passed, and then like I think she was hired by company. They provide some trainings free of
Yeah.
cost where she doesn't have to pay, and then like yeah, and then like she got some work. Yeah, she was hired. So like I was just wondering what like why we have to pay in this program, because some they gave free.
No, because you have to find out. You have to do your own research.
If you are
You came to
the
school,
permanent
right?
resident, you don't need to pay. Like mine is a different story, so that's a different thing. I'm a permanent resident, but I have something with like, so that's
Okay.
like I talked to Deshan and Maz about something, so it's different.
Yeah.
I
It's
can't have
not
regular
just,
classes, so
it's not just Fraser Coastal Health, also Providence Health. Some private facilities, they also are looking for HCAP. But the condition that after you finish, you work for them.
Mm-hmm.
So
yeah, the person who pays your money pays for your fees. You definitely have to work for them for a couple of months or a year.
Yeah.
That's it.
Yeah.
So don't worry, they won't fire you.
Okay. No, it's just that's what is available out there. Right? Yeah.
Um,
Any other questions?
Yeah, I wouldn't be taking the tomorrow's class.
Oh, I'm not here tomorrow. Somebody
Okay.
else is because my rotation starts. So I'll probably be in next week, Monday, Tuesday,
Okay.
because my regular 5 days starts tomorrow.
Oh,
Yeah.
where's our teacher? She's not gonna teach us anymore?
I have no idea. No, I used to teach for him for many years. I teach the LPNs, and so he asked me. I said, okay, I can come and teach. I was home anyways today, so let's see. But if you guys were in the evening class, then I would teach you permanently because I get up at 3.
oh. So like, how many students are there in our class? Just 3 of
There's
us?
supposed to be 7. Like I don't know what's going on with the other ones.
Oh.
Yeah, they said that in the next 2 weeks that a lot of students should be coming, but I don't see anybody coming, to be honest.
Yeah, I have no. I just come in, just whoever is there, I teach, and I go home. But that's the yeah. There's lots of RCAs. They work in acute too in the hospitals. But yeah, they get a little bit more money. I think it's $1.50 more. And then if you work night shift, that's $3.50 premium for night shift, and weekends is $2.50. So if you're working Friday, Saturday, Sunday night, you're making $6 extra an hour. But like our schedule, we are on the rotation. Like my shift stays 7 to 3, but my days off changes. It's not like fixed days off.
Like, do you guys have casual hours in long term?
Oh yeah. Oh, they have casuals. Yeah.
Okay.
But right now, casuals make more money than full time because you get 12.8% on the lieu of benefit because you don't get the benefits, but then
Yep.
you get 12.8% extra.
That's okay. Like I might be working 2 jobs then because I already have a job and they're covering my benefits, so I can work over the
Oh, yeah.
days.
Yeah. Like when I was young, like I worked 2 jobs. I used to wake up, do teaching from 5 to 10, go home, and then I work 7 to 3. I did it for like 2 years because teaching is easy. You don't know physically demanding, only your brain gets stressed. And then for nurses, hospital, like long-term care, 7 to 3 is easy because you don't do it. Nurses don't do any physical. We only give medication, do assessment, do charting and stuff. But in the hospital, you're doing everything. You have 5 patients, you're doing everything. All the way from personal care to medication, assessment, and everything. Even taking them at 2 in the morning in the morgue if they die. That was the most craziest thing. I worked at Eagle Ridge, and you have to go on in the tunnel to go the other side. If you've been there, like Bailey House, seen, and the hospital. So the morgue was in the basement of the Bailey House, and there's a tunnel that connects. So they're pushing a dead body in the tunnel at 2 in the morning. It's the most creepiest thing you can do.
Yeah. If he wakes up.
Yeah. What else, guys? Anything else you want to know? Clarify on the 2 infection control and grooming.
I heard that we can work while we go to school.
Yeah.
Is that-
Yeah.
So when can we apply for like the jobs? Like
Anywhere, like you can apply in long term, go on provincial or federal. I mean, not provincial, coastal. For
Like
example.
I think we can do it after completing the vaccination thing. And yeah.
Yeah, you can work like as an that we call a home support worker, but only certain things you're not gonna be allowed until you complete your course. But you can do like escort, patients to their appointments. Or if somebody is at risk of wandering, has dementia, you can stay with them, provide them meals and stuff, do the housekeeping, and you still get paid about $23 to $24 an hour. And once you get your care registry number, then you can start because you're already in the field.
Okay.
We have lots of them. They are they call non-skilled support workers. They cannot do any personal care or transfers.
Sir, I have doubt. Like, I'm an international student, so like my actual course will start this January from UCW, and then like I was wondering whether I can, like do job because I'm attending this program. I'm going to school, isn't it?
Yeah, do you have
So,
your work permit?
I'm under a study permit right now, but
Just,
student can do part-time job, isn't it?
yeah. Yeah, I remember like there were some bunch of students that came from Philippines and India. They can only work, I think it was 20 hours.
20 hours. 20 hours.
Yeah, 20 hours, right?
Yep.
Yeah.
And then, yeah. And they were working, they were all registered nurses that they came under the, during COVID, it's a provincial workload. And after they were graduated and they got the full time. But while they were in school, they only worked 7 hours they were allowed.
No, like right now, I meant to say right now because I know that I can do part-time job after I start my actual course, but then like like this HCA course is also the studies, no, like what do we say now? Do we have a semester in this program?
I don't know,
Three sem-
ask Michael because I don't know how this new program is.
Oh, okay.
Because things has changed
Yeah.
because I know the old system and then because I was mostly teaching the LPNs, right?
Mm-hmm.
So I know the LPN program better, but the HCA I used to teach once in a like wow. But I don't know how you guys are like, they should have given you the course outline, like duration and stuff.
Oh, I don't
Yeah, it's
remember.
a 5 months course, I suppose. 4 to 5 months course. 2 hours of 2 months of study and 270 hours of practical training. You can split the practical training into 210 and 210 hours and 60 hours.
Yeah, they already gave us the outline. I just don't think she got it though.
Yeah, I didn't.
Ask you come in and ask one of
Yeah, Deshaun and or Maz, he'll just
Yeah, because
guide you, walk you,
I don't want to give
brief
you
you.
the wrong information.
Yeah.
You ask me about any medical thing, I'll tell you. Put the course ahead.
I think it's better to go to immigration and ask about that.
Because I know that time during COVID we were so short of staff. There's about 20 nurses that came from. There were like 12 from Philippines and I think 8 from South India.
Mm-hmm.
And while they were in school at Stenberg, and they were sent in the field, but they were paid to be there. Like, so they said that I think there was only certain hours they can work under the student visa. So once they had complete the course, they got the RCA and then they got the work permit and they were allowed to work as many hours.
Yeah.
So yeah, maybe call immigration and ask them. And I know there's a certain conditions.
Yeah, last time I went to one immigration. There's Indian immigration there in Fraser Street. So like the guy said, if this program has 3 semester, then I can, but I'm not sure whether we have semester in this program or not.
And I think they will let you have a work permit because right now we are so short of workers. We're really short. Like, skill, like, the non-professional ones, especially in the home health and deployment, the ones that do the escort, like, do one-on-one. there's no available. They're sending nurses to do one-on-one because there's no support workers available out there. So that should allow you.
So like after getting certificate, do we have to do interview and then get a job?
Yep.
Even
Everybody
if you
interviews you.
start somewhere as an unskilled worker,
Uh,
they will hire you. Once you, all you need is your career registry number, and they'll hire you bang, because everywhere is short. Everywhere is short. Okay. Well, hopefully I can run into you guys again.
Yep, definitely.
But yeah, you know, I'm not allowed to say anything about anything. I just gave you the HCAP. Google it.
Yeah.
Okay, you guys have a wonderful evening. I mean, I'll probably get to see you guys next week.
okay, sir. Thank you.
Thank you, sir.
Okay. Yeah. And I forgot. If you guys have any issues, I'm gonna give you my email. How do I type? Just email me my first name, Shalandra, SALENDRA .Kumar, KUMAR @fraserhealth.ca.
Can you repeat SAL
ENDRA
Yeah.
.Kumar, KUMAR @fraserhealth.ca. So if you guys have any question, you can email me directly there. Sounds good?
Yep.
Okay, you guys have take care and have a wonderful week and good luck studying.
Thank you.
Thank you, sir.